in person and remotely. We ask everyone for their patience with any delays and technical issues. If you are registered to speak at today's meeting, please listen for me to call your name. I will call speakers in the order they appear on the list. The list of speakers can be viewed online by visiting the Board of Health page at toronto.ca/council and clicking the speakers box for today's meeting. The board secretary has provided all agenda materials on toronto.ca/council and via CMP, the clerk's meeting portal. Directors, please keep your mic muted unless you wish to question staff or speak to an item, and ensure that your video is turned on. As part of each agenda item, I will ask directors to raise their hand or unmute their mic if they wish to speak or ask a question. I will then create a speakers list and will call on directors when it is their turn to speak. When voting on an item or a motion, I ask that directors ensure that they turn on their video and to raise their hand to indicate their vote. Directors, I want to remind you that you must submit and approve your motions by email. Staff are available at boh@toronto.ca to help with motions. The Board of Health acknowledges the land we are meeting on is the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. The City of Toronto acknowledges all treaty peoples, including those who came here as settlers and migrants, either in this generation or in generations past, and those of us who came here involuntarily, particularly those brought to these lands as a result of the transatlantic slave trade and slavery. We pay tribute to those ancestors of African origin and descent. Are there any declarations of interest under the Municipal Conflict of Interest Act? If you have an interest, please raise your hand and unmute your mic and indicate the item number and the nature of the interest. I am seeing none. We need a motion to confirm the minutes from our regular board meeting on July 8th, 2024, and a special meeting on July 9th, 2024. Director Tendra-Vallon, all those in favor, opposed, carried. Thank you. So again, good morning and welcome back to everyone in the room and online. Since we last met, Toronto Public Health has been hard at work responding to public health events and preparing for the budget season here at City Hall. On August 13th, the World Health Organization declared mpox a global health crisis. While risk of serious illness remains low because the strain of the disease we are seeing in Toronto is different from the one recently identified in Africa, it is still important for eligible residents to get vaccinated against mpox. Toronto Public Health has been hosting mpox vaccination clinics, and vaccine appointments are offered by local 2S LGBTQ+ sexual health care providers across the city. However, we acknowledge that some eligible residents have not been able to secure an appointment and are working to improve vaccine delivery. For more information about vaccine booking, you can email publichealth@toronto.ca. In other public health news, last month the province announced changes to the regulation of safe consumption sites and $378 million in funding for new treatment hubs. Following this announcement, TPH was notified by the province that the supervised consumption services at 277 Victoria Street must cease by March 31st, 2025. While we welcome additional support for treatment and supportive housing as part of a full continuum of care for people living with substance use challenges, we know there will be detrimental impacts on our communities as a result of SCS closures. Toronto continues to be in the midst of a drug toxicity epidemic. Rates of non-fatal and fatal drug toxicity to overdose, including those due to fentanyl, remains high. Closing services that are successful in reducing drug-related harms is extremely dangerous, both for people who use drugs and for the broader public. Despite policy changes that are out of our hands, the City of Toronto continues its work to address mental health and substance use. Today, we will appoint 12 members of the Our Health, Our City Implementation Panel. These individuals bring with them a wide range of insight and expertise, including lived and living experience with mental health and substance use, to guide annual priorities, promote action on recommendations, and provide feedback on progress. Thank you to the over 160 candidates who applied, and to Deputy Mayor Malik for leading the process as chair of the implementation panel. Looking ahead to the end of the month, I want to recognize the National Day for Truth and Reconciliation on September 30th, when we will honor the resilience, strength, and stories of Indigenous survivors of residential schools, as well as those children who never returned home. The day serves as a reminder of Canada's ongoing commitment to advancing reconciliation, fostering respectful relationships, and supporting Indigenous peoples in healing and recovery. Finally, I would like to acknowledge the departure of Toronto Public Health's Director of Communications, Megan Kilty. Joining Toronto Public Health in 2021 amidst the chaos of COVID-19 response, Megan quickly proved as she was the perfect fit for the dynamic role. In the years since, she has used her expertise and strategic vision to help us navigate through countless public health challenges, communicating crucial information to public health with intention and care. In June, Megan led the Toronto Public Health Communications team to win 2 Ovation Awards from the International Association of Business Communicators, the Award of Excellence in Government Communications for our mpox campaign, an award of distinction named Toronto Public Health Communications as Communications Department for the year. Please join me in congratulating Megan and expressing our deepest gratitude for her countless contributions to Toronto Public Health. Megan, thank you for your unwavering dedication and exceptional service. We're incredibly fortunate to have had you on our team. Thank you. Now turn it over to Dr. Davila.
Thank you, Chair Moyes, and good morning to the members of the board. Here we are, it's September, and September is often characterized as a fresh start after the summer break. But as you've just heard from the chair, this summer has been anything but quiet for Toronto Public Health. And significant changes are on the horizon for public health in Ontario. As you've heard, this includes the Ontario government's decision to close 5 supervised consumption sites in Toronto by March 2025, including our own service at the Works. This shift comes as part of the province's launch of its Homelessness and Addiction Recovery Treatment, or Heart Hubs demonstration project, meant to provide treatment and recovery support for those facing addiction, homelessness, and mental health challenges. And as mentioned by the chair, these changes have certainly raised concerns, but we at TPH remain committed to meeting the needs of our most vulnerable populations. Beyond these structural changes, over the summer months, we've tackled multiple public health priorities. As you know, Toronto has endured several heat waves, prompting swift action to ensure our residents were safe and informed. Our infectious diseases surveillance remains robust, addressing a resurgence in cases of measles, invasive meningococcal disease, pertussis, mpox, just to name a few. And of course, we provided targeted vaccination campaigns and outreach efforts in addressing these situations. There's also positive news. Childhood immunization demand is increasing post-pandemic, and we're actively supporting families throughout the city. We've also intensified our efforts to combat youth vaping, providing resources to schools and educators to protect the health of our young people. including a new vaping cessation program to support Toronto's educators. Core public health programs like health inspections, mosquito control, beach water quality monitoring, and vaccination clinics were also active and in full swing, working to ensure the health and safety of our city. And in the past few days alone, we've heard of a human case of rabies in this province, the first acquired in Ontario since 1967, and the identification of an H5N1 influenza or bird flu case in an individual in the United States with no known exposure to infected animals or birds. All this is to say that our environment is constantly shifting with new developments and issues arising all the time. As a small example, which you'll actually have the benefit of hearing a little bit about today, the budget considered by the Board of Health's Budget Committee has changed not once, but twice since their meeting, and that was just a month ago. But thanks to the quick and efficient work of our colleagues in our business and operations team at Toronto Public Health, we've continued to be able to adapt to new directions, to funding updates, and to emerging priorities. And while I provide this information to you as context for today's discussions, particularly our discussion on the 2025 budget, I would like to take a moment to acknowledge that the vast majority of our financial resourcing at Toronto Public Health goes towards staffing. The people of Toronto Public Health are at the core of all that we do. They are the foundation of this organization, and they are the reason that we are able to respond to the ever-changing landscape. This is why in our recently approved strategic plan, we have a priority focused on our people and our culture. And it is also why I would like to take the time once again to thank the dedicated Toronto Public Health team. Despite the evolving challenges and shifting priorities, despite our fatigue, and I do use that word deliberately, there is a great deal of fatigue. Despite that fatigue and the constant need to respond, our staff continue to innovate, adapt, and serve our city with true excellence. And if the board will indulge me just for a little bit more, as the chair has already done, I would like to give special thanks to one particular member of the Toronto Public Health team. As you've heard, Megan Kilty joined Toronto Public Health in March of 2021, just as our COVID response was a little over a year old, and as our vaccine clinics were in their earliest days. I think that her joining our organization at that time says a lot about Megan's commitment to our mission at Toronto Public Health, her commitment to the city, and her approach to challenging circumstances. And since that time, there has been no shortage of challenge, certainly not in our world. And throughout every single one of those challenges, Megan has been as solid as a rock, always bringing her strategic insights, her formidable communication skills, and what I have described as a cheerful pragmatism to the work of helping us communicate with our public and our many partners and stakeholders in service of the people of Toronto. Megan Kilty will be leaving us to take up the role of Chief Public Affairs Officer at the Financial Services Regulatory Authority of Ontario. So this will be her last Board of Health meeting. So Megan, from all of us to you, you have been an incredible communicator, a remarkable professional, a model public servant, the truest of colleagues, and someone whom we are very, very proud to call our friend. Our sincerest and deepest thanks to you, and our very, very best wishes as you embark on your new role. The FSRA is incredibly lucky to have you joining their team. So with that, thank you, Chair Moyes and board members for your patience with me. And with that, I will now turn the mic back over to you, Mr. Chair.
Thank you, Dr. Davila. So we will now review the agenda. I do have one new business item. I did circulate that earlier. I need to vote on that. Yep, put it up on the screen. It's really around the mpox, making it more accessible and available for providers to give it. Because right now, it's limited as to who can give it and how much. So I'd like to add that to the agenda. All those in favor? We got to vote. All those in favor? Opposed? Carried. Thank you. Item HL 16.1, update from the Medical Office of Health Hiring Committee. There's a presentation on this item, so I'll hold it down. Item HL 16.2, Toronto Public Health 2025 operating budget submission. There's also a presentation on this item, so I'll hold it down. HL 16.3, Toronto Public Health 2025 to 2034 capital budget and plan requests. There's also a presentation here, so I'll hold this item down. Item HL 16.4, Toronto Public Health operating budget variance for the 6-month end to June 30th, 2024. Would anyone like to hold this item? Seeing none. Dr. Chandravalan, you want to move this item? All those in favor? Opposed? Carried. HL 16.5, Toronto Public Health capital budget variance for the 6-month ending June 30th, 2024. Would anyone like to hold this item? Seeing, you want to hold it? Sure. Or you want to move it? Do you want to hold this item to speak to it, or do you want to, or you want to move it? Okay. Okay. All those in favor? Opposed? Carried. Item HL 16.6, Mobile Dental Care Program 2025 update.
I'd like to hold that, Chair.
Pardon?
I would like to hold that item, Chair.
You want to hold it? Okay.
Yes.
Item HL 16.7, appointment of members to the Our Health, Our City Implementation Panel. Anyone like to? Deputy Mayor Malik? Okay. You want me to hold it down? Okay. All right. So members, I'd like to propose the following for today's agenda. We do have quite a large speakers list for item 16.2. I'm going to ask that we close the speakers list at 10 a.m. I do have a motion for that. The speakers who have not pre-registered be allowed to register to speak until 10 a.m. All those in favor? Opposed? Carried. Thank you.
Mr. Chair? Mr. Chair?
Sorry, go ahead. Go ahead, Councillor Perks.
Mr. Chair, I just wanted to alert you, I may have some legal questions pertaining to that item. And I just wanted to alert you, I may need to go into camera and also to see if someone from the legal department could contact.
The legal is here.
Okay.
Okay, thank you, Councillor Perks.
If I could I'd still appreciate someone getting in touch with me, okay?
You and someone to get, we have some difficulty hearing you. Can you just repeat that?
Right. I know you know my cell phone number. Could you share that with someone with legal and have them get in touch with me, please?
Okay, will do.
Thank you.
Okay. So item HL 16.2, Toronto Public Health 2025 operating budget submission, and item HL 16.3, Toronto Public Health 2025 to 2034 capital budget plan requests be considered together. Do I need a motion for that?
I think it's consensus.
Is the board okay with that? These two items Okay, thank you. Okay. No motions needed. Okay. So we'll now consider items that were held. So items HR 16.1, update from the Medical Office of Health, hiring committee. So I know there will be presentation on this item. There are no registered speakers. I think Phelps is going to come up and give us an update. Jason, you can introduce who you're with.
Absolutely.
Thank you.
Thank you, Chair Morris. In today. So we do have a bit of a deck that we'll share here just to give some insights. One moment. Okay, excellent. So as a brief update, we are well underway already on the recruitment for the new Medical Officer of Health. We got out to market within the last 2 weeks, and we've already started having conversations with potential candidates, and we've been doing a lot of outreach. So we're very much on track for our schedule as planned to get through our screening with the selection committee late September into early to mid-October, and we are on track to come back to the board later in the year with a recommendation. So we've gone through over the last 3 weeks now, I think, Fareed? About 3 weeks, we've gone through a fairly extensive consultation. We've had conversations with well over 20 individuals so far, board members, key stakeholders across the city and partners, as well as external stakeholders. It's been a combination of one-on-one conversations, and we have also been running a digital survey to receive feedback. What we've got today is just an overview of the feedback that we have received, and this becomes the underpinning and that foundation that we use on how we present the opportunity to potential candidates. But this also feeds right into the selection committee and the criteria the selection committee will be using as well to assess candidates as we get to the screening phase. We'll jump right in. We've got 4 slides, and Fareed and I will jump back and forth a bit here as well. So starting off on the candidate profile, you can see some of the skills and attributes. Obviously, there are core aspects that are required for the Medical Officer of Health under legislation. We have not outlined those factors here. There's certainly requirements. But in addition to that, around skills and attributes, you can see it's a fairly broad mix. And current Medical Officer of Health certainly brings the majority of these skills, so big shoes to fill. We're looking for an individual that can come in with the collaboration and the partnership building skills. This is across the city, across city departments and divisions, but beyond the city as well, to external partners, to healthcare sector, to community partners, to school boards, to post-secondary. It's a very broad mix of partnership, and we've come to realize just how much public health touches every area of our city. We need an individual that has the visionary skills, that can look into the future and can help public health determine what is the direction and where is public health going and where do our priorities sit. Obviously, the communication skills are critical, and this would be communication, of course, to the board, across Toronto Public Health, but that ability to communicate and work across a broad mix of stakeholders within the city. And truly be able to, again, build the collaboration, build the partnerships. Crisis management. As we know, we've come through a fairly large crisis in the last number of years, and the Medical Officer of Health certainly front and center. So we need an individual that brings the calmness, the adaptability, the ability to navigate situations that are stressful and tense and drive crisis as well. The political acumen, obviously, the ability to navigate within the city, within city council, within the board, but in addition to that, other levels of government. The ability, again, to build partnerships and to navigate, but be able to advocate on behalf of Toronto Public Health to other levels of government. That resilience, I would tie this into that crisis management as well, an individual that can handle the stress of the demands of this position. Equity and inclusion, diversity, equity, inclusion, core values for the city. And again, a leader that truly lives these values and can continue to drive this as core aspects for Toronto Public Health. The cultural understanding of Indigenous communities and the unique health needs as well associated with Indigenous communities. The leadership cultivation, an individual that can cultivate leaders both within Toronto Public Health, but an individual that can cultivate leaders beyond the reach of the Public Health Board as well. And finally, that genuine, authentic, and truly evidence-based type of leader. Somebody that can use evidence to communicate compelling direction, advocate, and drive Toronto Public Health forward. So we'll go through the whole presentation before we open it up for questions and just touch on some of the challenges if you want a paper copy.
Yeah, thanks, Jason. So just continuing on, and you might find that there is some overlap between Jason and myself and the slides, because it's while it's challenging to define all of the roles and responsibilities, some of these things overlap. So the fiscal constraints and budget, we heard about some of that this morning, where the city is being asked to deliver on provincially mandated programs with a fixed budget, notwithstanding the challenges that the city might have in terms of its own criteria and its own priority. Public health emergency and infectious disease, obviously, Jason spoke to some of this. We're seeing this more and more, and we heard about that this morning again. Intergovernmental coordination, the ability to work across government, working with the federal government to a lesser extent, but greater interaction between the provincial government, but also the colleagues within the GTA and beyond. Many of the public health challenges that we find in the 416 area is not confined by geography. So the ability of that leader to be able to work across the GTA, work between the provincial and the municipal government, and also touch from time to time the federal government is an important issue. The considerations around vulnerability with the population served by the City of Toronto. And we've mentioned here the socioeconomic, ethnocultural, and spatial inequities. And this came out in many of the consultations we had. A number of your colleagues spoke about the challenges faced, and some of this was apparent during the COVID-19, where there is clearly inequity in terms of health considerations across the City of Toronto. Issues around mental health and addictions. The social determinants of health became an important underpinning of this position. So before it became a public health issue, how does the city anticipate and plan for some of these challenges that might exist down the road? Looking at maintaining and strengthening public trust, and I think we saw a great deal of that during COVID-19. You had an authentic leader, someone who the public trusts to provide information to them. There is a consideration that the city needs to sort of promote and strengthen that public trust that was gained and acquired during COVID-19, so that when you bring evidence to bear on the conversation, the public can have some confidence in what's being heard. And that authenticity that Jason spoke about also, I think, is an important consideration here. Issues around anti-Black racism, and this was particular and it go beyond the vulnerability that I spoke about earlier. This and the health considerations within Indigenous community continues to be an issue that I think would challenge this individual and the city as it deliberates on how to provide the best public health considerations across the city. Dealing with other city departments, and again, while public health might seen as having a specific mandate, the need to have this collaboration with other city departments is becoming increasingly important. So what transportation does, for example, or what Parks and Recreation does, do have an impact on public health. So the consideration here is that the public health officer needs to be engaged in some of these conversations at the ground floor so they can influence public policy when they're being made outside of pure public health considerations. Looking at building partnerships is a very complex organization. So how do you ensure that you build partnership with not only the city departments, but also city agencies, and how do you leverage that to ensure that you have successful health outcomes? Opioid crisis was one issue that was mentioned specifically. The shortage of primary care physicians, I think, is a fairly self-evident and self-explanatory. Looking at the health assessment of new Canadians and the ability to do that early assessment to be able to address any emerging public health consideration that might be seen. Looking at community engagement, and I think this this goes beyond simply medical practitioners, but looking at elders and others within the community who may have input into the public health considerations. How do you engage a community? How do you bring quote-unquote stakeholders that are outside the traditional realm? And how do you get that conversation going within the public health policy initiatives? And then also moving forward with the Ministry of Health Policies and Interventions within the context of the budget and other considerations. And the issue here is not only about money, but it's also about those unique public health challenges faced by the City of Toronto.
Keep going on opportunities.
On the innovation, on the opportunities piece, obviously there's lots of work to be done. Looking at innovative health programs in an integrated way, and the use of technology was specifically mentioned. How do we leverage that to ensure that we get the best outcome? Proactively addressing some of the systemic challenges, and I spoke some of that earlier. How do you leverage partnership? Toronto is known for its health hub and the significant and innovative and important health research that happens in the hospitals and other health systems across the 416 and GTA area. How do you leverage that and bring some of that to bear on the considerations that the City of Toronto is contemplating through the public health portfolio? Advocating, this individual has to be a strong advocate for increased resources and funding for public health challenges, looking at the integration of social determinants of health, so getting ahead of the curve, as they say, looking beyond the here and the now, and dealing with some of these systemic challenges. Evidence-based and data-driven considerations. While the political acumen is an important consideration here, the consensus view was that you need an individual who can come to the table with evidence and data, and the considerations being brought forward by the Chief Medical Officer of Health has to be driven by evidence and by data consideration. Building public health infrastructure to deal with considerations that might be forthcoming. Commitment to bold leadership. I mean, so this individual not only has to lead an organization consisting of hundreds of people and millions of dollars of budget, but also be someone that is a visionary, someone who's inspiring, someone who can motivate and inspire their staff to do the kind of programs and policies and operations that is required by those who live, play, and work in the City of Toronto. The interdependence of building a healthy city. I mean, public health consideration is just one of those things that has to be juxtaposed against broader considerations across the city. How do you do that, and how do you ensure that those opportunities are brought to bear? And leveraging and building on past success. I mean, the city has had a really incredible, successful run during COVID-19. How do you consolidate? How do you build? How do you extend that public trust into those other areas where the city might be vulnerable or where people are looking for leadership? And there is some reference to lactation clinics, safe dining, and travel vaccines, which are opportunities to rebrand and strengthen that public trust that the city has deservedly achieved during the COVID-19 crisis.
So as you can see, it's a fairly long list of items for the new Medical Officer of Health to step into, and lots of challenges, but lots of opportunities as well. We'll wrap up with our final slide here, just around future success. And this question really comes to, as we have our consultations, looking out a year and a half, give or take, and what would the individual have achieved in that time to demonstrate success? So here's collectively what we've heard. I think the first two certainly tie together. That execution around this newly minted strategic plan, really driving the metrics and the operational components of that strategic plan now, and being able to articulate and clearly define the public health priorities for the city, get the support and get the buy-in across the leadership team, and the understanding across the city as well, and the partners. Providing the support and continuing to enhance partnerships. We heard, as we've talked about, we've heard some great feedback from some of the general managers and other key partners across the city about Toronto Public Health. But the message was, we have so much more we can continue to do. We have a lot more opportunity still to strengthen these partnerships, using the data and really driving decisions based on that. Providing the adequate support in marginalized communities. Establishing priorities and guiding the department's focus, of course, as well. You'll see a lot of this is tying into that strategic plan execution, the clearly defined metrics, and clearly defined priorities as well, so that there's engagement. Of course, driving and refreshing new policy initiatives and revamps around that side, especially as there's changes continually taking place at the provincial level. That leadership engagement, the Toronto Public Health leadership team has come through a lot in the last few years, and there hasn't been a pause. So they've come out of the pandemic, and there's an aspect here of continuing to find ways to engage, to balance as well, to balance the workload for the leadership team and find ways to give opportunities to have pause. That refocus on core areas. And again, this is continuing to ensure that Toronto Public Health is focusing on the broad mandate. The pandemic becomes all-consuming. And so as it continues, as Toronto Public Health continues to shift and recover, I would say, coming out of the pandemic, is again focusing on the broad mandate. And similar to Fareed's point earlier, a few specific items that had come up through the success factors being the Youth Mental Health Framework and the Healthy Aging Initiatives. So we could drop screen at this point and open it up for any questions, Chair Moyes.
Thank you for the presentation. There we go. You can see the members on screen. Any questions from the directors? In the room or online? You did such a great job. Councillor Thompson, go ahead.
Thank you, Mr. Chair, and I do agree that they've done a great job. I'm just wondering, where is the input from the outgoing medical officer of health? How have you consulted with her?
Yes, actually, great question. And we just had a conversation late last week. So that has been incorporated. We have a few updates still to do from the outgoing medical officer of health, but we have tried to reflect her comments in the broad mandate here as well. And her feedback will also be feeding into the selection committee's screening criteria as we get there.
And just final question, you've listed, and you and Fareed have listed a series of elements, I guess, as part of the selection process. What is uniquely different about this series of, or list of things, the competency, communication, and empathy, and inclusion, and so on? What's different about this list versus the previous list in which we hired, for example, Dr. Davila?
That's a great question. We weren't on the recruitment previously, so I don't have the previous list. We would have to take that back, Councillor Thompson, and do a comparison to the previous criteria. I don't have the previous criteria.
You would agree, though, that that would be at least important?
Absolutely, yes. Yes, we will take that back and we'll work with the team to get the previous criteria and dig up what we can from Toronto Public Health around that screening criteria and do a comparison, absolutely.
Sure, thank you. Those are my questions, Mr. Chair. Thank you both very much for your presentation.
Okay, thank you. Director Roy, do you have a question? No? Any further questions? Yeah, seeing none. Director Ozode, go ahead.
Thanks so much for the important work that you all have done. Just reading through the agenda, and it says you're working to prepare the job profile for the posting. Should I assume that the posting has already been done and you're currently screening?
So the posting has been done, yes, and approved by the board. So the posting is live at this point. We haven't got into our screening yet. We're currently out to market right now. So we're currently in the phase of approaching potential candidates. We've developed our research list. So we're reaching out right now, still piquing interest. We're in those early phases. We will start to get into our screening later in September as we start to collect applications and receive interest. Mm-hmm.
Yeah, thank you. Seeing no further questions. I'll move a motion to adopt the presentation. All those in favor? Opposed? Carried. Thank you. The next item is item HR 16.2, Toronto Public Health 2025 operating budget submission, and HR 16.3, Toronto Public Health 2025 to 2034 capital budget and plan request. I'll ask Dr. Davila to introduce the presenters.
Moyes, and good morning once again, members of the board. For those of you who are members of the Budget Committee, you will be familiar with Madeline Vo, my colleague, who's just taking up her seat at the presenter's desk. She is one of our managers in our Operations and Business Services area, and she, in fact, has done, along with members of the team there, the heavy lifting in respect of this year's 2025 operating budget submission from Toronto Public Health, and as well the 2025 through 34 capital budget submission. These submissions are, of course, part of the city's budget deliberations. Although we are a division that reports through a board, similar to other city divisions, we are participant within the larger city process, and we are subject to city timelines. So in fact, you will see our materials not only here, but they will go through the city budget process as well. Again, just a reminder to the members of the board who are not part of the Budget Committee, this information was presented in large part to the Budget Committee on July 23rd, just a few weeks ago. As I mentioned in my opening remarks, there have been some changes. They are reflected here, and Madeline will take you through them. You'll see in our agenda that we've got the overall capital budget and plan request, the 2025 operating budget submission, and then a high-level summary in respect of 2025 service levels, which is part of the budget process. Just a reminder to everybody that the direction we did receive through the corporation was for a net zero budget, given the particular financial circumstances in which the city finds itself. So with that, I'm now going to turn it over to my colleague, Madeline, to take us through the presentation. And thank you in advance, Madeline.
Thank you, Dr. Davila. Good morning, everyone. Thank you for the opportunity to present to you this morning the 2025 operating budget and capital budget and plan submissions. So So let's start with the capital budget and plan. So for the 2025 budget request, which is the first fiscal year of the 10-year plan, we are requesting a budget of just under $4 million at $3.9 million for 4 technology projects and 1 project for the dental program. And for the total capital budget and plan, which is the 10-year time frame from 2025 to 2034, we are asking for $23.9 million. Next slide, please. So this slide will provide you in kind of the details of related to the project that we are requesting in our 2025 budget. The first being the electronic medical records, phase 3. This is to implement a new client information system to provide a comprehensive electronic records of health-related information for our patients to be used in our Toronto Public Health sexual health clinics and needle exchange clinics. The second one is a new project. It's electronic medical record phase 4. This is to expand this new EMR solutions to the tuberculosis program. This project is expected to be completed by 2027. The inspection management implementation, so this project is to replace our current inspection system, which has reached its end of life. So we are leveraging the corporate customer relationship management tool called Salesforce to improve the efficiency and effectiveness of inspections, investigation, and enforcement service delivery. The fourth project, again, this is a new project, but it is a continuation of the inspection management system where we're gonna expand this new inspection management to the rabies program. This project is expected to be completed by 2026. As I mentioned earlier, we have 1 project for the dental program, and this is to procure a new van for the municipal dental program. This is largely to, to reach shelters and community service to serve adults, largely 18 to 64 years old, and some youth who are staying in shelters or some seniors adjunct to the long-term care home. The focus is really to bring care directly to the vulnerable populations who might not have access to dental care program for a variety of reasons. Next slide, please. Okay, now let's talk about 2025 operating budget. And what you see here is the continuity schedule that will provide you with what our approved budget was in previous year and what is the new operating budget is that we are submitting, putting forward for submission through the city budget process. So back in February, the city approved our budget of a total of 278.8 million in gross expenditures and 77.7 in net expenditures. And then from that numbers, we kind of put in any in-year adjustment. First item being the increase in budget for the Healthy Babies, Healthy Children program from the Ministry of Children and Community and Social Services. The increase is about 6.8%, which translates to about 1.3 million from April 2024 to March 2025. We also add back about 900,000 for the injectable opioid agonist treatment program, which we receive extension to March 2025. We also have a change in salaries and benefits of about 1.9 million. This is to address the inflationary increase for our staff and also for the pay for performance for our non-union staff. So that brings us to a restated 2024 approved operating budget of 282.8 million in gross expenditures or 79.7 in net expenditures. So then from this restated operating budget, we then add in the incremental budget change for 2025. As I alluded earlier, our IO program, we received expansion to March 2025, but as of right now, there is no indication that we continue to receive the funding. Therefore, you see an incremental reductions of about 1.1 in 2025. We also reflect the termination of provincial funding for our supervised consumption sites as of March 2025, and that translates to an incremental reduction of 1.2 million in 2025. And then we also added the increased revenue from the Ministry of Health, and this is to reflect the 1% increase for our cost share program from 2024 to 2026. 400,000 of this 1.9 is applies to 2024, and the remaining 1.5 is for 2025. And then we add also the increase in budget for the Healthy Babies, Healthy Children program, and this is the remaining 300,000 for the period from January to March, because the fiscal year of this program runs from April to March. And then the next item is all the salaries and benefits, 1.6 million incremental increase. This is mainly, again, related to the inflationary increase for our staff and also the pay for performance for our non-union staff. We have an increase of 886,000 for our student nutrition program, and this is really to address the year-over-year cost of food increase of about 2.5%, and also a expected participation growth rate of about 2.2% year-over-year. And then we have a about 400,000 decrease in technical, administrative and technical adjustment, and this is just mainly predicated around the decrease in interdivisional expenditures. So that brings us to a 2025 preliminary operating budget of 282.8 million in gross expenditures or 79.8 million in net expenditures. So from a year-over-year perspective, we are looking at this point in time, an increase of 98,000 or 0.1% increase. Okay. Next slide, please. So just quickly over the service level. So for 2025 budget, it includes 63 service level, 11 are new following the review that we have completed last year, and 52 existing describing activities across Toronto Public Health. And so we have put these new, there is no change with the budget committee presentation. So, but we did put it on the presentation along with the existing, so for your reference. So that brings us to the end of the presentation. Thank you.
Thank you, Madeline. We do have, thank you. I had a lapse in, okay. We have the deputations, so Madeline, if you take your seat, and I'll call the first deputant. Daniel Freehit. You're online?
Yep, I think I'm on.
You have
Good.
5 minutes, Daniel. Go ahead.
Okay, great, thank you. I see there's a big speaker list, so I'll try to keep it fast and talk fast, but slow me down if I'm going too fast. And I'm using my own stopwatch this time. Many of you know me, I've long been outspoken about certain public health measures regarding COVID in particular. But lately, in other departments, I'm seeing that sometimes government intervention has its own set of health consequences, detrimental health consequences, obviously beneficial as well, for the most part. I saw this with the rollout of the COVID vaccines and some of the restrictions on employment, and some of the restrictions on assembly and the health impacts that had on various segments of the population. And I was hoping at some point various levels of government would start doing some self-reflection in the form of independent inquiries, independent commissions. It hasn't been done. It's been funded now largely by civilian groups with after-tax money, amazingly. The health consequences of, in particular, coercive vaccination resulted in the setting up of a federal vaccine injury support program. Last meeting, I delegated requesting, it was a long shot, but that this board set a budget for taking over responsibility for the vaccine injury support program. A colleague commented that was a long shot and kind of idealistic, and I recognize that was a bit perhaps too much of a long shot. This budget doesn't address anything related to a self-reflection of the city's response to COVID, and I think that self-reflection does need to be budgeted. It does need to be taken into account what went right, what went wrong, who was detrimentally affected, was the response proportionate, and getting accurate data. Getting accurate data has been an issue for various reasons. And I see, by the way, I saw a bunch of speakers were added to this meeting starting from September 7th in the last 2 days. I'm not sure if that was a part of a coordinated response. Sometimes they form associations behind the scenes. I think it was a pretty diverse group, but at least with the previous Board of Health meeting, the noise, people addressing the noise issues in the city came together and formed a very cohesive group to address the noise in this city. And kudos to them for mobilizing and getting the message across, because I heard that. I heard their message and I hear the noise now. Point being, vaccine injured folks tried to form associations and get together and make groups, primarily online on Facebook. But guess what? Those groups were destroyed. Those associations were devastated. They were accused of spreading misinformation, even amongst private groups, amazingly. There's been a couple of other groups that tried to pitch in and help. Take Action Canada started collecting names of people, third parties that were harmed by the vaccine. Again, I don't know for a fact that the extent of the injuries in all these cases. I do know that the Vaccine Injury Support Program is going through a backlog of vaccine injuries, and I know that there was a Freedom of Information Act request asking for details of the adverse event following immunization. Health Canada couldn't get back to them because there's too much. There's millions of pages apparently, so they have to refine now the searches. Unlike to this person, this is again after-tax money. Who's paying for all these searches? Like, this should not be on the public now, or these lone groups to fund this stuff. This should be something tackled by the Board of Health. I don't want to use my 5 minutes. I want the other folks to talk, but you guys never asked me questions, so I want to take 30 seconds to ask myself questions. Mr. Freiheit, we have situations here where a number of us, including the medical officer of health, made these recommendations that are now going to potentially, create an awkward situation. How do we address that? Either conflicts or, well, it's a good question. I think what you have to do is look outside the board, look at hiring someone. And again, this isn't a pitch for my independence, because I have my own perspective on this. Although I do consider myself quite independent for the most part. It's time to find that this board sets aside a budget for self-reflection in the form of an independent counselor, therapist, or like kind of a group therapist for the board, and say, what did we do right, what did we do wrong, who's been harmed, and how can we make this better? I do have 45 seconds if you want to ask any questions, but otherwise, get on with the other speakers. Thank you so much.
Thank you. Any questions for the deputant? Seeing none, thank you for coming in today. Next deputant is Jillian Evans from Mark Garneau Collegiate Institute. Are you here? Online? Okay.
Hi, I'm here. There we go. Turn on my video. Okay. Thank you, Chair, and to the Board of Health for listening to my deputation this morning in support of increased funding to schools for student nutrition programs. My name is Jillian Evans. I'm the principal of Mark Garneau Collegiate Institute. We're a high school in the Thorncliffe and Flemington Park neighborhoods and home to over 1,800 students, making us the third largest high school in the Toronto District School Board. And I'm coming to state the obvious that everyone on this call knows, that countless studies and publications have reinforced our understanding when students in schools have something to eat, they're more likely to be able to focus and experience success. Here at Mark Garneau, we're the recipients of some of the largest nutrition funding grants in the city. We service two of the city's highest priority neighborhoods, home to more than 7,000 school-aged children, most of who have arrived in this country within the last 5 years. We have an annual grant of approximately $160,000. That gives us the ability to provide 100 hot breakfasts, 200 hot lunches, and 1,000 healthy grab-and-go snacks per day. But we can't do it on our funding grant alone. We highly subsidize through fundraising. We grow most of our own vegetables with the support of community volunteers, and as a result, we're able to reduce the cost of fresh produce while increasing access for students. We maximize the power of the bean and the lentils, giving students high-protein, inexpensive meals that are reflective of their cultures, mostly because our modest budget allows us to serve meat only once per week if we're lucky. But if you do the math, you'll easily calculate that our $160,000 annual grant allows for approximately 80 cents per student per day. So I want you to take a moment and think about what you could make and pack for your lunches for 80 cents per day. Student-sized carton of milk is 90 cents, whole bananas close to $1. We can't give kids what they need to learn on the existing grants, and even with our active fundraising, growing our own food, and dipping into my very modest school budget, we don't have enough. We know that on April 1st, 2024, the federal government announced the new National School Food Program, investing $1 billion over 5 years. The money's been promised, and my ask is to start to see the money where it's needed here in the schools. Thank you.
Thank you very much. Any questions for Principal? Seeing none, thank you for coming in today. Sarah Watson, North York Harvest Food Bank, are you here? Hey. Good morning. You have 5 minutes.
Food Bank, and I am here to speak in favor of increased funding for the student nutrition program. North York Harvest is the primary food bank for Northern Toronto. Our catchment stretches from Steeles in the north to Eglinton in the south, from Highway 27 in the west all the way over to Victoria Park in the east. That's nearly a third of the geography of the city. We have been providing emergency food support to community members in these areas for nearly 30 years, but never have we seen the level of demand that we and our partners have been faced with over the last several years. In July of 2019, we saw roughly 13,000 visits to our programs, 1-3. This past July, we saw nearly 30,000. And of that 30,000, 27% of those were children and youth, more than 1 in 4. 18% were 12 or younger. We also see every day that poverty and food insecurity does not impact all people equally. Racialized communities, in particular Black, Latin American, Middle Eastern, and Indigenous community members and their children are all vastly overrepresented in our programs. And newcomers to Canada, those who have come here with the promise of opportunity for themselves and their children, we also see at vastly disproportionate rates. Last year, as part of the annual Who's Hungry survey that we conduct each year in partnership with our colleagues at the Daily Bread Food Bank, 16% of parents said their child had gone hungry at least once a week or more in the last 3 months. That was up from 12% just the year before. And we know that that comes as a last resort to families who will do everything in their power, including skipping meals themselves, so that their children can eat. No child anywhere, but especially in a country as resourced and wealthy as Canada, should a child ever go hungry. The impacts of food insecurity and hunger on children are far-reaching and have a profound effect on their health and well-being, but also on their ability to learn. A child who goes to school hungry cannot be expected to learn or to focus. It's our understanding that last year there were 21 additional schools eligible for funding, but lack of budget meant they could not be added, and that many existing programs are struggling to provide adequate food to students with their current funding. And all of this at a time when our city is facing a level of crisis in terms of poverty and food insecurity that North York Harvest has not witnessed in our 30-year history. We have never seen the level of demand for emergency food support that we are facing right now, and quite frankly, it is unsustainable. Food bank programs will and have collapsed under the pressure we are currently facing. We cannot move forward like this as an organization or as a city. North York Harvest strongly supports the Board of Health reiterate its request that the Government of Canada expand the National Foods Program, School Food Program, to provide funding for a universal student nutrition program, and that the Province of Ontario increase its investment to match that of the City of Toronto and to address the inflationary costs of food. Food banks in the charitable sector alone cannot and should not carry the weight of this crisis. All levels of government must work together to ensure that all of our children have access to the food and nutrition they need to grow, learn, and reach their full potential. A fully funded universal free school nutrition program would go a long way to helping us reach that goal. Thank you.
My mic is not on. Any questions for the deputy? Seeing none. Thank you for coming in today. Melissa Wong, Social Planning Toronto. Good morning. You have 5 minutes.
Hello, thank you, Chair and members of the Board of Health, for the opportunity to address you about the Toronto Public Health 2025 operating budget submission. My name is Melissa Wong. I'm the Director of Engagement and Strategic Initiatives at Social Planning Toronto. We are a nonprofit charitable community organization that works to improve equity, social, and economic justice. In our efforts to address policy and systems change, we collaborate with over 150 community-based and grassroots organizations that collectively represent tens of thousands of economically and socially marginalized residents across the city. I'm here today to voice Social Planning Toronto's support for the Board of Health Committee recommendations to increase student nutrition program funding. For many years, Social Planning Toronto was tracked, reported, and organized to advance solutions and investments that will reduce the impacts of poverty in our city. We know from the most recently available data on child and family poverty that there are almost 97,000 children in Toronto living in low-income households. That means a child and family poverty rate of more than 20%, an increase of almost 4% between 2020 and 2021. So the increase in student nutrition funding is needed now more than ever. In the past year, we've been working with a group of community partners to identify policy solutions that could help those who are struggling to respond to the rapidly increasing rates of food insecurity. The number one recommendation was to increase long-term and flexible funding for food security, including automatic inflationary increases to the student nutrition program to cover rising food costs, and making breakfast and lunch programs universally available in all publicly funded schools in Toronto. We are a long way from having universally available student nutrition programming in the midst of growing need. According to Toronto Public Health's own reports of approximately 855 public schools in Toronto across the 4 public school boards, there are still 235 that do not have a student nutrition program. The staff report on 2024 student nutrition program service subsidies indicate that despite requests for new programs and increased demand, there's not enough funding to approve new programs. For existing programs, the ongoing reliance on school communities, parents, and volunteers to fundraise and deliver these programs is unsustainable and inequitable. As a parent myself, I've seen the disparity between school communities who are able to subsidize and fundraise for their student nutrition programs and schools who do not have this capacity. Not surprisingly, schools in higher need communities often end up with programs that run out of funding during the school year, while some programs are forced to reduce the amount of food that's offered to children or the number of days that they run their programs. More often than not, these are communities in higher racialized populations, including Black, Indigenous, and newcomer populations. Despite living in the wealthiest city in Canada, the sad reality is that many children in our schools are going to school hungry every day, and we and our governments are failing them. Every year, Toronto City Council has approved increased funding for the Student Nutrition Program. But as inflation rapidly increases and demand grows, this funding is insufficient to meet the rising demand of our school communities. Ontario has provided one-time funding increases, and the federal government has announced a national school food program. But the money isn't flowing fast enough, and it's not enough to keep up and feed our children. The Board of Health Budget Committee made 4 crucial recommendations to address this growing crisis, which includes increasing the municipal contribution to 20%, calling on the Government Canada to fund a universal nutrition meal program for every school-aged child, calling on the Province of Ontario to increase its funding for the Student Nutrition Program to match Toronto's investment and fund inflationary food costs, and to work with the provincial and federal governments to expedite Toronto's share of the $79 million promised for student nutrition this year. Social Planning Toronto strongly supports these recommendations. We need all levels of government to step up. This is why we urge you, the Board of Health, the Mayor, and members of City Council to do everything in your power to hold the other levels of government accountable to their duty to the children of Toronto. I would also like to speak briefly to the closure of the safe consumption sites and the end to needle exchange programs. Safe consumption sites are a proven life-saving program and should be continued as part of a full spectrum of services for people who use drugs. Moreover, needle exchange programs have been around since the 1980s as a necessary measure to prevent the spread of disease. Ending these programs is irresponsible and counter to public health principles. I urge the Board of Health and City Council to continue funding these services and work with the Province of Ontario to halt the closure of these services. Thank you for your time and consideration.
Thank you, Melissa. Any questions for the deputant? Seeing none, thank you so much for coming in today. Susan Wright, Summer Lunch Plus, are you here? Online, okay. Susan, here we go. You have 5 minutes. Hi.
Hello, my name is Susan Wright, and I'm the founder of Summer Lunch Plus. Our goal is to bridge the gap when school food programs are on break during the summer months. And I would like to thank you all for increasing the investment in student nutrition in the last budget. And I would like to shout out Deputy Mayor Morley for working with me to expand the city's definition of student nutrition to include summer as a critical window of support for children. We just wrapped up our 9th summer of running our food literacy and cooking skills program. This year, we had the opportunity to reach even more children and their families in Thorncliffe Park. We continue to deepen our support in Alexandra Park, and we are very pleased to share that we ran programs in Ottawa and Orangeville for the first time. It's an opportunity for us to practice scaling in communities outside of our long-standing Toronto partner neighborhoods. While packing meal kits in Thorncliffe Park this summer, I heard from many families, but one story has stayed with me. A mom approached me. She caught my arm and was worried that I was worried that she was unhappy somehow because she seemed agitated and had a sense of urgency about her. She said, "I'm so glad to meet you. I have to tell you about your program. I've been here in Canada for 6 months. I'm from Morocco, and I was very concerned about your recipe for couscous because it's not the way we make it at home. But I encouraged my daughter to make it anyway because our program is a cooking program for kids. We loved it so much. We sat on our floor of our living room and dished out 11 servings in plastic cups so we could share with our new neighbors. We hadn't met them before, and this felt like a reason to introduce ourselves. Now, we share food with our neighbors most weeks, and they share with us too. You helped me and my daughter create community through food, and it feels less lonely now." The rising cost of food and the corresponding increase in ultra-processed food consumption makes it critical to ensure families can access nutritious food year-round. This is not just about feeding children, it's about empowering families with skills and knowledge to shop and cook affordably. While supporting school nutrition programs is vital, I urge the City of Toronto to take the next step. Invest in a pilot program that extends support through summer. During the summer months, food bank usage spikes, and families struggle with the safety net that school food programs provide. I've spoken with Sahar, a fellow advocate from the Daily Bread Food Bank, and we both agree that children deserve more than their basic needs. They deserve a holistic, robust program that not only addresses food security, but also offers essential life skills, social connection, and food literacy over the summer when they're missing that necessary support that school provides. Today, I asked the City of Toronto for two things. One, establish a dedicated summer food budget for 2025, allowing organizations like mine, Summer Lunch Plus, to scale and meet the growing needs in our city. And two, I would welcome the opportunity to collaborate with those developing food security solutions to share more about our proven program, which has demonstrated positive impacts on shopping habits, cooking skills, increased consumption of fruits and vegetables, and more. Thank you for holding these consultations and listening to folks like me who feel strongly about growing healthy kids who will grow up to be healthy adults in the City of Toronto. Thanks.
Thank you, Susan. Any questions for the deputant? Seeing none, thank you for coming in today. I love couscous, by the way. Omar Khan, Engaged Communities. Good morning. There we go. 5 minutes. Yep.
Okay, hi everyone. I'm Omar Khan. I'm the coordinator of a grassroots group called Engaged Communities that works in Thorncliffe and Flemington. And along with York University and TNO, we studied the local experience of food insecurity from 2021 to 2023, which is of course directly connected to the student nutrition program. So when we spoke with local parents, the majority of them newcomers about food insecurity, they listed all the connected challenges. I want you to listen to this parent talk about her struggles when she thinks about putting food on the table. Oh. Can you guys, I can't hear this. Hold on, let me see. Technical difficulties.
No, text coming.
Sorry?
Tech is behind you there.
Oh, yeah, sure.
And check the audio. Okay. Setting. Give me a second.
Yeah, sure.
Pause your time. You can just tell us what she says, okay? We're tight on time today.
Okay, well, yeah, so,
Pause 3 times, right?
So our research made clear that the student nutrition program won't get to the heart of food insecurity issues, which is of course poverty, but it can still help families by feeding their kids on school days. And so research shows that children who consistently have a healthy meal in the morning are more engaged in the classroom, have better learning outcomes, show better problem-solving skills, and have healthier relationships. Studies have also shown that the school food programs can contribute to lifetime of healthier eating habits, reducing the risk of chronic disease later in life. And so the huge return on investment in student nutrition programs is realized over the course of each child, and that's why almost every OECD country has a national student program, nutrition program, but not Canada. And in Canada, about 1/3 of students in elementary schools and 2/3 of students in secondary schools do not eat a nutritious breakfast before school. And those percentages here in Toronto are even higher. So this is what I see on the budget submission today. So it's an $886,000 increase to the student nutrition program to cover inflationary costs. So this gets us to 17.4%, not the 20% of the student nutrition budget that the board recommended in July. So just frankly, this is not enough. Look at these Toronto Food Bank visit numbers, skyrocket in 2023, and we've heard it's skyrocketing even more. So in low-income communities where I work, the demand has grown even more. One thing I really want us to think about is that the residents told us, frontline workers, to consider the ways in which we are part of the system that maintains food insecurity for certain individuals. And I think the Board of Health should really think about that. If the Board of Health is not meeting its own student nutrition goals, and it's not knocking down the doors of the province and the feds, then we're not helping Torontonians most in need. We're just turning our heads away while we hope that the food bank bandage can do something that they've acknowledged they can't. So what is needed? First, funding, obviously. The Board of Health and the mayor need to be finding every opportunity to engage the feds and the province. It is terrible that the federal money is not flowing as this school year has already started. And it's a shame on the province for not helping either. But money isn't enough. Something is really broken with how we're doing the student nutrition. If we have schools in dire need, and I know some of those schools that have no student nutrition program, our goal should be a universal program, and the current model is just not going to get us there. Finally, of course, the board and the city more generally need to work on the core challenge, which is poverty and affordability. So thank you to the board for considering these needs. These are our research partners. And if you want to learn more, the food report is there, and I have submitted this to the board. Thanks.
Thank you, Omar. Any questions for the deputant? Give me a second for my... Any questions for the deputant? Seeing none. Thank you for coming today. Dr. Dan Werb, Director, Center on Drug Policy Evaluation, St. Mike's Hospital. You're online. Dr. Werb, you have...
Hi there.
Go ahead.
Thank you so much for having me. I'm the director of the Center on Drug Policy Evaluation at St. Michael's Hospital, and I'm also the chair in mental health and substance use disorders at St. Michael's Hospital and the University of Toronto. So I want to talk today about the impact of supervised consumption sites on the death of people who use drugs in Toronto. And I'll start with a question. What would you say if there were an intervention that could reduce death among Toronto's most marginalized communities by 2/3 across entire neighborhoods in the midst of an overdose crisis that has claimed more lives in this province than COVID-19? This would be an incredibly cut and dry situation if we were talking about anything other than the incredibly stigmatized behaviors surrounding substance use. So I just want to share my screen and elaborate a little bit. Oh, it looks like I need to be made a presenter. Okay, thank you.
Simply share your screen. Okay.
Can you see that? Yep. So earlier this year, we published a paper in the Lancet Public Health, the world's leading public health journal. We worked closely with the Ontario Chief Coroner's Office and analyzed overdose mortality across the city of Toronto. And this work, led by Indu Ramahan, a brilliant young scholar, demonstrated that neighborhoods in which supervised consumption sites were implemented experienced a 2/3 reduction in overdose mortality. This reduction was not only experienced very, very close to the sites, within 250 meters, not only within 500 meters, but there was a 2/3 reduction in overdose mortality as far as 1 kilometer away. We saw similar reductions 2.5 kilometers away from these sites and within 5 kilometers even. And all of these are statistically significant reductions. We did not see similar reductions in neighborhoods in which sites were not opened. Furthermore, this is a little bit harder to see, but I'll just note that the longer the sites were opened, year over year, the stronger the protective effect of these sites were against overdose mortality across neighborhoods. In the face of this evidence, which is just one piece of the growing and quite large evidence that has led to a scientific and medical consensus that supervised consumption sites are among the best interventions we have to prevent overdose mortality. Given this consensus, given that what we know has happened here in the city of Toronto in terms of overdose mortality reduction, it is absolutely unconscionable that we are facing the closure of these sites. And I call on the board to ensure that the works remains funded and to work with the other sites that are facing closures and budget cuts to ensure that they remain open. Thank you.
Thank you. Councilor Perks has a question for you. Go ahead.
Thank you for that, Dan. That's very powerful. And I'm going to be getting in touch with you to get that data. Some people in the conversation have made the argument that you can simply substitute other services that are not harm reduction based and get the same outcome. Do you agree with that, or do you challenge that?
I fundamentally disagree, and I'll just say that, first of all, I've submitted this paper to the board, so you should all have a copy of it. The only reason that we're talking about a harm reduction versus treatment binary is because governments have been unwilling to fund a comprehensive system. There is nothing in the scientific or medical literature to suggest that harm reduction and treatment are in competition. This is a fictitious political dichotomy. The fact is that harm reduction is the single most effective way to connect with people who have the greatest need for treatment. And not only the closure of the supervised consumption sites, but the restrictions around the supplies of harm reduction materials that will accompany these hard hubs really makes it difficult to understand how and why people would be connecting with these sites and communities if they can't provide them with life-saving interventions, like a medically supervised place to inject, and materials like sterile syringes that can ensure that they don't die of infectious diseases like hepatitis C and HIV. I've likened this to the idea that you're building this big gleaming hospital, state-of-the-art hospital, and you don't add doors, right? Like this is an incredible investment. This is an investment that should have happened years and years ago, and I'm talking about the $380 or so million in treatment that the Ford government announced. But there's no reason that this should be decoupled from harm reduction. At best, the closure of these sites will really reduce the effectiveness of this investment. And at worst, it will absolutely undermine the progress that we've made. And it is very difficult to call it progress, but we know for a fact that people have remained alive because of supervised consumption sites, and the work that I and others have done have shown that this is linked directly to the implementation of harm reduction services here in Toronto and elsewhere. At worst, we will see an increase in the number of Torontonians who die of preventable deaths. And again, we have had more people since this fentanyl-driven overdose crisis has started in around 2017 in the province that have died compared to COVID. We didn't know what was killing people with COVID, and we were able to save more lives than we've let die of a condition that is entirely preventable.
So Dan, I think I heard two things, and I'm just going to ask if I'm heard correct. You're saying first that treatment does not replace harm reduction in terms of saving lives, and secondly that the two together are the best outcome.
Absolutely. I don't think that there's any advocate out there or any observer, scientific or otherwise, that suggests that it's an either or, and there are ways that treatment can help, of course, stabilize people. Opioid agonist therapy is the most effective solution that we've got to help people manage opioid use dependence. It's on WHO's list of essential medicines for exactly that reason. But treatment in and of itself does not get people through the door. You need to get people through the door, and you need to keep people alive so that they can access treatment.
Thank you very much, Dan.
Thank you. I have a question. So you work in a hospital setting. How will the elimination of SCS impact the strains on your department or the hospital in general?
There's a number of different strains that it will impact. So first of all, absolutely emergency department volumes will increase at St. Michael's Hospital where I live, well, I practically live there, where I work. We already have an emergency department that has the highest proportion of people who are presenting with substance use related conditions. And that is just going to increase as the various sites across the city are closed and the sites that remain are overburdened and are not provided with additional budget to manage the additional clients that they see. So in the emergency department, absolutely. We'll also see knock-on effects across departments with likely increases in the presentation of people with hepatitis C infection, with HIV infection, with endocarditis, which is basically an infection of the blood, which is incredibly complex and costly to treat. And all of this is preventable. I'll also say that there are knock-on effects for public health generally. Toronto Public Health has been a strong partner in Toronto's drug checking service, which provides voluntary, highly detailed analysis of the contents of unknown drug samples for people who need that. And this has been a key data source to inform Toronto Public Health's rapid alerts that can provide communities across Toronto and in fact the GTA and Southern Ontario with information about specific drugs that are circulating that can result in greater overdose risk or more complex overdose presentations. The drug taking service operates, it effectively operates out of supervised consumption sites in the city of Toronto. And if those close, it will detrimentally affect the capacity of Toronto Public Health to not only serve people who use drugs, who are at grave risk of overdose, but serve entire communities who desperately need information about what's circulating in the drug market. And it's not only people in the public health sector, that includes law enforcement, That includes public policymakers, and the ripple effects are very, very detrimental.
Okay. Thank you for that. Any other questions, the deputy? Seeing none, thank you again. On the list, Dane Kent, Manager, Region Park Community Health Center. Are you here? Here you are. Go ahead, you have 5 minutes.
Good morning, members of the Board of Health and fellow community members. My name is Dane Kent. I'm the manager of the Consumption and Treatment Service at Bevel Up, which is located within the Region Park Community Health Center. I'd like to say that we are standing on the brink of a public health disaster across Ontario. The provincial government's decision to defund 10 sites across the province, 5 of which are within the city of Toronto, will have catastrophic consequences for communities across the province. This isn't just a policy decision, it's a decision that will cost lives, and its effects will ripple far beyond the cities where these sites are located. Every 2.5 hours, someone in Ontario dies from the toxic drug supply. These are entirely preventable deaths, and they're happening because we are failing to provide the support to the people when they need it. Supervised injection sites are on the front line of this fight. These are not merely places where people use drugs, they're facilities where lives are saved, where people can access life-saving care and be connected to the supports and the broader systems that they need. In the past 3 years, 9,300 overdoses have been reversed in these sites. That's 3,100 lives saved per year. If these sites close, these overdoses will not simply disappear. Since 2018, 391,112 injections have occurred within Toronto alone. They will happen in alleyways, parks, and public restrooms across Ontario. And the people affected will not have access to the critical life-saving interventions that they need. Without these sites, paramedics will be tied up responding to an additional 9.5 overdoses per day, adding 6,935 hours per year to their workload. That's the equivalent of more than 3 full-time paramedic positions, an unsustainable burden on our already strained emergency services. What happens when emergency services are flooded with overdose calls? What happens when our first responders can no longer keep up? Will we see ambulances backed up at emergency rooms, leaving the rest of the city unprotected? People who could have been saved will die waiting. The very system designed to protect us will collapse under the weight of this new decision. Emergency services across Ontario, paramedics, firefighters, and police will feel the strain. When overdose calls flood 911 dispatch, ambulances will be tied up, hospitals will be overwhelmed, and our first responders won't be able to keep up. This isn't just a healthcare crisis, it's a public safety crisis. And it will affect every community, rural and urban, in our province. Without these sites, the 6,200 ambulance hours saved every year by on-site overdose reversals will be lost, creating delays in response times and risking more lives. We need immediate action. First, we must launch a province-wide advocacy campaign to demand the provincial government reverse this reckless decision. From Toronto to Thunder Bay, from Windsor to Ottawa, communities need to unite and make it clear. We will not stand by while these life-saving services are taken from us. Second, I call on the leadership of our emergency services, police, fire, and paramedics across Ontario to stand up and speak out. They know what this will mean for public safety, and their voices are crucial in demonstrating the true gravity of this crisis. Third, we need to appeal to the federal government for support. Harm reduction is a national issue, and when provincial policies put lives at risk, the federal government must step in. Fourth, municipalities across Ontario must explore alternative funding sources to keep these sites open in the short term. We cannot let the sites close while we fight for permanent solutions. We owe it to our communities to keep this essential public health infrastructure intact. Finally, the provincial government must recognize that we are in the midst of an opioid crisis and declare a public health emergency. This is not just an urban problem, it's a provincial problem. Declaring an emergency will send a strong message that we will not accept more lives being lost to these decisions. The cost of this decision will be paid in lives. The lives that we would have saved at our site, and the lives of mothers and fathers, brothers and sisters, and children that Ontarians will watch drift away while frantically looking for the ambulance that they've called, but they can't hear the sirens for. In closing, these injection sites are not just about harm reduction, they're about saving lives and protecting communities. In the last 3 years, they've reversed thousands of overdoses, prevented countless deaths, and eased the burden on emergency services. They are essential to public health infrastructure in Ontario, and we must fight to keep them open. Thank you.
Thank you. Councillor Perks, go ahead, 5 minutes.
Oh, muted.
You can't hear you, Councillor Perks.
Sorry about that. Thank you for that deputation. That was really powerful. You've made a suggestion that a certain number of ambulance hours would need to be, it would be impacted. How do you come to that figure?
So the average amount of time that an ambulance is tied up on an overdose call is roughly 2 hours. That includes the time to get to the call, the time at the call, the time from the location of the call, transport to the hospital, and then generally the longest amount of time is the wait for the transfer of care to the emergency room departments. So if we look at the amount of ambulances, which the Ontario ambulance chiefs, like paramedic chiefs of Ontario, suggest that there's 830 ambulances within the province, and we're seeing, if we say 9.5 overdoses per day at 2 hours per overdose, take that with the amount of ambulances available, and that's how many hours you would generate each year in terms of having that would be added to the system, right? There's already 14,000 overdose calls dealt with by paramedics every year, and we're adding 9,000 to that.
So almost doubling it. Wow. Okay. Thank you.
Thank you. I do have one question. Do you have any stats for your clinic in a month's period? Like how many clients do you see? How many overdoses take place there, perhaps?
Oh, I have plenty of stats for my site. So Bevel Up sees about 10,000 people a year. Of that 10,000, about 800 are unique individuals. Our site becomes cost neutral to the downstream healthcare system if we prevent Hep C transmission in less than 1% of our injections. We see about 150 overdoses per year at our site. And of the 800 people that access our site every year, we have over 1,500 unique individuals referred to secondary supports, which means that each person accessing our program is also connecting to 2 other programs within the context of our integrated ground floor model.
Great, thank you for that. Appreciate it. See no other questions. Next up, Marina Klassen, Toronto Overdose Prevention Society. Are you here? Online? Okay.
Hello, everyone. Thank you so much for having me this morning. Good morning, Board of Health. Thank you for the opportunity to speak with you this morning about the 2025 operational budget. My name is Marina Klassen. I'm a frontline harm reduction social worker. I have worked in this field for the past 10 years. I'm here to speak to you about the need for an increased municipal funding to protect and keep operational life-saving harm reduction services in our city, and the need for the board to protect and speak up to the health rights and safety of Toronto citizens. The majority of my career has been under the heavy shadow of a public health crisis, the toxic drug poisoning crisis. It's been like living through a war. I've lost countless clients, colleagues, friends, and community. Overdose does not discriminate. It impacts communities in every demographic of our city. I don't need to tell you that it's become one of the leading causes of death for Ontario citizens under 65. One person dies every 2.5 hours in Ontario, even with existing overdose prevention services we have in place at this moment. That means in the course of just this meeting this morning, we have lost another precious human life. These are friends, children, siblings, parents, and loved ones. I don't need to remind the members here that the closure of SESs across the city will be a death sentence. We know as experts in our field that this will result in mass death, increased transmission of Hep C and HIV, and add an incredible burden on the healthcare and emergency responses systems, as Dane pointed out today. They are already crumbling services. And despite what Ford's government says, this will decrease public safety by pushing substance use and overdoses into the streets, traumatizing bystanders who are unprepared to respond. When you close supervised consumption sites, your whole city becomes an unsupervised consumption site. In Toronto SESs alone, nearly 11,000 overdoses were reversed just between 2020 and 2024. That's 22,000 reversals in SESs across Ontario. There has never been a single death in an SES. We know they are simple, essential, evidence-based services that keep people alive and connect people to supports. Taking away one key intervention and restricting the freedom of municipalities to implement the solutions that their communities need and have invested in for years is impractical, unfair, and irresponsible. So Ford's decision to shut down these services means Toronto communities have less tools available to support themselves and will be at a net loss. SES has already provided the services that the new Heartless Hubs model is proposing to deliver, plus offering life-saving overdose prevention. This investment is not an equivalent replacement of care. So investment in housing, which is really what this proposal is actually talking about, not an equivalent treatment. They're not actually promising treatment services, and they're not actually promising beds, treatment beds, or OAT or detox beds. They're just talking about housing. So we're not creating an equivalency of harm reduction services and life-saving plans. We have an Ontario Healthcare Act for a reason, so that our healthcare doesn't become a political tool to be played with at the expense of our well-being and lives. So Ford's actions to close SESs flies in the face of all of our protected rights for health. I think that your responsibility as a Board of Health is to ensure the public health and program services are delivered to the city in response to the need. So your role is to reduce inequalities, to create accessibility, and to improve the health of the city and the city population. So we need your leadership more than ever. Your voices matter so much. We need you to stand up to the Ford government, advocate for our most vulnerable in our communities, and if necessary, we need you to find funding within your operational budget to keep safe consumption services and harm reduction services open in the 5 Toronto sites slated for closure, if the province decides to recklessly proceed with the defunding. So we need your leadership now more than ever to protect Toronto citizens from the Ford's conservative authoritarian decision to deny evidence-based life-saving healthcare. Lastly, I want to echo the call to declare a public health crisis. Please name this crisis for what it is. Challenge the province to not only in words, but also in actions, and find the funding to keep SESs open. Thank you very much.
Thank you. Any questions for the deputant? Seeing none. Thank you, Melissa, for coming in today. Marina, sorry. Serena Birdie, Board Chair, Friends of Kensington Market. Okay, you have 5 minutes, go ahead.
Chair of Friends of Kensington Market, a not-for-profit community organization. I'm also a PhD candidate in health policy and health services research at the University of Toronto. And I'm here to oppose the closure of overdose prevention sites, including the Kensington Market Overdose Prevention Site, KMOPS. My former PhD thesis supervisor prior to his well-deserved retirement, Dr. Greg Marshallton, perhaps best known for his work on the Romano Report, would speak to incoming policy students, and each year he started with one piece of advice. Remember, our work is not bloodless. He said that to remind us that as health policy experts and the people affected by policy decisions, that there are many layers of insulation between, and I pass that caution on to you in this insulated room in City Hall. Policy and budgetary decisions can be violent when they cause real injury and death, and that is something that must be taken with the utmost seriousness. The recent provincial 2025 budget submission and medical officer of health recommendations before you today present serious policy issues that are repetitions of decisions that were objective failures. These include failures in timeline, in evaluations of cost effectiveness, and in justification through community safety. The most glaring failure is a mismatch between the closure of effective overdose prevention sites and the potential opening of proposed heart hubs. We have seen this happen before with the closure of mental health institutions in the early 90s. This common sense revolution, later called the War on the Poor, and the current provincial government seems set not just on repeating it, but amplifying it. Community treatment orders were offered up as the solution, but with no bare minimum policy floor Governments were not required to ensure that adequate resources were in place to implement CTOs adequately or in a timely manner. And instead, what we saw is what experts at the time described as mass transinstitutionalization from hospitals to streets and prisons. We are still paying the price for that failure today. As I've said multiple times, witnessing policy failures throughout the recent pandemic, we have to learn from this and do better, not worse. The recommendation before you would result in the closure of existing OPS sites by March 31st, 2025, while the heart hubs are vaguely planned to begin operations in winter 2025. That is the kind of gap that people fall through. Today's decision is being made before the heart hub application deadline even closes in October. There is neither enough evidence that heart hubs will prove effective at all, let alone more effective, or any reasoning provided as to why this large gap in service timeline exists. We don't have detailed information about what these hubs will look like in order to responsibly make a decision right now, and this service gap will inevitably lead in itself to loss of life while services are unavailable. This leads to a question of cost effectiveness. One thing that I think is not discussed enough in health systems is the inefficiency caused by dismantling existing programs that work. We know that our OPS sites work, and that took a lot to establish. They took time, training, trust building with the precarious populations they serve. We know that they are operating effectively now, and it will cost us considerably more as taxpayers in public health, safety, and mortality, and in health professional fatigue. Without these services, we will pay astronomically more by addressing these patients with the only tools we'll have left: hospital emergency rooms, overburdened emergency services, and prisons. We will predictably see unsupervised substance consumption and increased preventable overdose mortality, as other deputants have spoken to. This brings me to community safety. I live in Kensington Market's strange and wonderful alleyways, and I have lived there for over 20 years, before and after the opening of KMOPS, the overdose prevention site, in 2019. I can tell you with certainty that I know where people will go when they don't have access to safe injection sites. I have also spent the last week speaking to neighbors, both residential and commercial, who shared fears that this will mean more substance use in parks and alleyways and public bathrooms. And I can speak from experience in saying that there is nothing safe about finding someone experiencing an overdose or worse, already dead on your doorstep. Do not use community safety in our name to justify this catastrophic decision. I urge you to learn from the intelligent deputants who spoke today and the policy failures of the past, and stand for evidence-based, responsible, and compassionate models of care. In the 2023 Chief Medical Officer of Health report, Dr. Kieran Moore recommended increased access to safe injection sites. Do not allow the closure of KMOPS and other safe injection sites, and certainly not without a viable and established alternative. You may never know the people affected by your decisions today, but we know their names and faces in Kensington Market. I know future policy scholars will be looking at transcripts from decisions made here today, and your names will be part of our history and future. Know that your work here today is not bloodless. Thank you.
Okay, thank you. Any questions for the deputant? Seeing none, I do have one question.
Yes.
Just for clarification, in regards to heart hubs, do you see them as part of the continuum of care in addition to harm reduction and safe consumption sites?
It was difficult, even as a person that's fairly experienced with reading policy documents, to get a clear sense of what was actually going to be established. And as I mentioned with the timeline, it would already be an unsafe transition. If there is a way to actually invest more without doing the dismantling work that's being proposed, I think it would be both safer for communities and it would represent an actual expansion of care. Right now, what's being proposed is vague. It's too far off from the proposed closures, and we don't have enough details to even make a decision as an informed public.
Okay, thank you. Next on my list is Ola Sakladrska.
Well, I have one question.
Oh, sorry. Go ahead, Councillor Perks. I didn't see you.
That's okay. Thank you very much for your deputation. I just want to make sure we clearly understand. The best system is one that has both very strong harm reduction safe consumption services and has housing and treatment supports as well. Not either or, but both.
Yes, but we didn't actually see any proposals to build, maybe I missed it, but I didn't see any proposals to actually build more housing in this. So I'm not
asking if I'm not asking if the provincial proposal is right. I'm asking the best model is harm reduction services, treatment services, and housing supports.
Absolutely, if they do actually come together, but it's not clear where that's actually coming from at this point.
Okay, thank you.
Thank you. And Ola, please help me pronounce your name properly. Skudalarska, Leslieville Harm Reduction Coalition. Online? I think I saw you earlier.
Sorry about that. Hello.
There. Can you help me
Am I connected now?
Can you help me pronounce your name properly?
Ola Skidlewska, you were correct.
Thank you. 5 minutes. Go ahead.
Thank you so much. Hello, my name is Ola Skidlewska. I am here today as a social worker, a harm reductionist, a neighbor, and the founder of Leslieville Harm Reduction Coalition. Today, I want to address HL 16.2, recommendations 1.A and 1.H, which concern the decrease to the budgets of the injection opioid agonist treatment program and the supervised consumption site due to the end of federal and provincial funding for these programs. These services must continue, and the city must provide the funding needed. I want to emphasize the importance at the municipal level of providing evidence-based compassionate care for people who use supervised consumption sites and who use injectable opioid agonist treatment. As a social worker and public health professional, I know that these interventions are life-saving and dignity-providing, and that scientific evidence and public health research identifies these as most effective and best practice. Thank you to Dan Wood, Dane Kent, and Selena Purdy for sharing this research today. As a harm reductionist, I know that harm reduction, the idea of supporting people to be safe in all of their choices, is fundamentally necessary to the kind of city Toronto is and wants to be. As a community member, I am tired of watching my neighbors and friends and family die. And as a neighbor, I am angry that my fellow neighbors are speaking over me when they say that these programs make their neighborhoods more dangerous to them and to their children. We are at a turning point in public health policy, and Toronto has a choice to make, both about public health policy, but also about the soul of who this city is for. People who use drugs live in Toronto. They always have, and they always will. They are our friends and our neighbors and our convenience store owners and our dog groomers. They belong here, and they deserve evidence-based support. They will not disappear if we defund these supports. They will be forced to exist in parks and alleys and in bathrooms. Defunding supervised consumption sites and injectable opioid agonist treatment will not make us safer. It will not make the streets less chaotic, and it will not stop children from finding needles. Defunding these programs will lead to those children finding bodies. It will lead to the paramedic and emergency medical system being even more overwhelmed with repeat calls responding to overdoses that could be supported calmly, without naloxone, and without hospitalization at sites that are already embedded and trusted by the community. Financially, ethically, and politically and medically, we cannot afford to defund these programs. Toronto must increase funding for these programs and expand them significantly, as well as push to decriminalize substance use to combat the illicit toxic drug supply and replace it with a regulated supply and a suite of public supports. Most importantly, Toronto as a city must advocate to the provincial and federal government for the expansion of harm reduction services and to combat the misinformation campaign and moral panic that is positioning harm reduction and recovery against each other, as well as people who use drugs against their neighbors. This is our city, and we must stand together to protect our most vulnerable and our neighborhoods. Thank you.
Thank you very much. Any questions for the deputant? Seeing none, thank you for coming in today, Ola. Next up is Colin Johnson, Toronto Harm Reduction Alliance. Are you here with us? No, we don't see Colin in the room or online. We'll move on to, again, help me pronounce this properly, Masquane Masquesine Agnew, Toronto Indigenous Harm Reduction.
Good morning. My name is Ms. Gwasson Agnew. I'm a Dene and Cree woman from Salt River First Nation and a Toronto resident. I work with Toronto Indigenous Harm Reduction as well as Street Health OPS. I'm speaking to you in regards to the proposed budget, which does not include expenses to run safe consumption sites. While many of the council members have expressed solidarity with harm reduction workers and people who use drugs in the city, it is clear that the council has accepted the closure of these spaces. I'll remind you that this decision was reversed back in 2018. When people access safe consumption site spaces, they are not only in a safe place to consume drugs, they are accessing countless referral services. Many of our clients depend on these spaces to support their overall health and well-being. In the month of September, many of you will be wearing orange shirts and giving land acknowledgements. You will talk about our trauma and our stories. You're talking about the people I serve and my own family members. Indigenous people make up the highest demographic of people who access these spaces. By making the clear and conscious decision to not include SCS operational costs in your budget has been made clear once more that the City of Toronto does not care about Indigenous people. As council members, you have the decision-making power to say no to heart hubs, which will merely act as drop-in centers and only offer half of the services that SCS spaces provide. As council members of the Board of Health, you should know that forced treatment is not evidence-based. As council members, you will be held accountable for the wave of drug poisoning, preventable spread of infectious disease, and death that is to come should SCS no longer be operational in the City of Toronto. The empty statements of solidarity and keeping SCS sites open are meaningless without your action and the commitment to keep SCS operation costs in your budget. Despite policy change, it is clear that the council has already accepted the decision to close SCS sites, which many of us are fighting to reverse. We are calling upon you to be bold and take leadership. We will not accept that these matters are out of your control. My relatives deserve to live another day, and they deserve one more sunrise. Thank you.
Councillor Perks. Go ahead, Gord. You're on mute.
Thank you very much for those very powerful words. You mentioned that forced treatment is not evidence-based. Could you talk a little bit more about that?
Yeah, so definitely having access to treatment is part of harm reduction, should that be what the individual chooses. Unfortunately, that's often not the first mode of care that is available to people. We know that waiting lists are incredibly long, and so by the time that people are ready to go into medical detox or any form of treatment, you know, it's often not the first avenue that people will take when accessing care. And so oftentimes an SCS and OPS is a way for them to access those services, but by simply coming in and being in a safe place to consume their drug of choice before they can get to that step if that's what they choose.
So the evidence is then that the person who uses drugs has to be the one to decide when they're ready to go into treatment. Is that fair?
That's correct, yes.
Okay, so having life-saving and supportive, frankly, safe consumption spaces opens that path so that when a person is ready, then they can take it if they wish.
Yeah, and so many different avenues, whether that be, you know, safe supply or, you know, choosing abstinence or choosing what we refer to as recovery, that's up to them, yeah, and can be referred to those from SCS bases.
Great, thank you so much.
Any other questions to deputies? Seeing none, thank you for coming in today. I appreciate that. Owen Evans, Unity Health Toronto. Is he online? No. Evans not in the room or online. So we'll go to the next person. Hannah Stahl, Toronto Metropolitan University. Are you here? Online, okay. Hannah, you can unmute yourself. You have 5 minutes, go ahead. Can you hear me? We can't hear you though.
Can you hear me now?
Yes, we can. Go ahead, you have 5 minutes.
Sorry about that. I'd like to thank the chair and membership of the board for allowing me the opportunity to speak today. I'm speaking as a constituent of Ward 10, a street nurse that has provided healthcare access to unhoused Torontonians for half a decade, and a grieving sister who lost her older brother to preventable overdose 7 years ago. With Toronto now facing the imminent threat of having 5 of our overdose prevention sites shut down, my clients and community need the city to take bold, swift action to protect those most threatened by the moral panic afflicting the provincial government. I applaud the councillors here who have taken the time to visit a supervised consumption site and see firsthand the beautiful work that we do. It's a privilege as a nurse to be able to offer gentle, low-barrier healthcare to people who are often enduring the hardest moments of their lives. Every day, these sites continue to catch Torontonians when they fall through the cracks. Sites have been intentionally placed in areas of greatest need. Research tells us that overdose prevention sites reduce overdose deaths in a 1 kilometer radius by 2/3, as has been mentioned previously today. Sites decrease hospitalizations among people who use drugs for debilitating wounds by about half, and reduce regional ambulance calls for suspected overdoses by 2/3. Of course, as we know, sites also significantly reduce transmission of HIV and hepatitis C. And I also want to mention that there's yet to be any validated data linking overdose prevention sites to crime. In fact, oh, sorry.
My apologies, sorry, continue.
Okay. I think it's important to note that, in fact, Toronto Police Service's own publicly available data indicates that these sites help reduce most forms of crime. The site that I work out of is in Ward 13, and we see an average of 600 visits every month and reverse, on average, 38 potentially deadly overdoses each month. These are individuals who can go on to contribute to their communities, access treatment, and won't be dying preventable accidental deaths in public spaces. Without these safe sites, Toronto will see a significant rise in public drug use, discarded paraphernalia, ambulance calls, transmission of various blood infections, and overdose deaths. I want to urge the city to use this critical moment to declare a public health emergency as we stand to lose the final tool that we have in the toxic drug crisis within which we find ourselves. The City of Toronto must publicly acknowledge the stress this decision is going to be putting on our municipal health infrastructure and put pressure on the province to reverse this decision that flies in the face of all research, ethics, and clinical guidelines. If needed, my clients and community need the city to implement interim solutions to keep our sites open and explore alternative funding to these essential services. The province has stated that they will not approve any new sites, so it's of utmost importance that the city step in so that we do not forever lose these indispensable sites that we already have. Thank you.
Thank you very much, Hannah. Any questions for the deputant? Seeing none, thank you for coming in today. Next up is Sahar Raza, Daily Bread Food Bank. Are you here, online? Okay. Want to unmute yourself?
Sorry, my video doesn't seem to be working. Can folks see me?
We can hear you though, so you could start.
Be brief, yeah, thank you. Good morning, Chair and board members, and thank you for the opportunity to speak with you today. My name is Sahar Raza, and I have the privilege of working as Vice President of Research and Advocacy at Daily Bread Food Bank, which is a member-based network of over 200 food banks and meal programs across Toronto, working to end hunger and poverty in our city, in all parts of the city outside of North York, from which you already heard from my colleague Sarah. In addition to the horrifying statistics that Sarah from North York Harvest spoke to earlier today about child hunger in our city and among our food bank clients, I wanted to share the scale of unsustainable demand that we are seeing at our Toronto food banks today. Just a few months ago, our network served over 350,000 food bank clients for the first time. That's the highest we've ever served in a single month, and it's 4 times our pre pandemic levels. For reference, this could fill the Rogers Centre over 7 times. More than 1 in 10 Torontonians now rely on food banks to survive, and we continue to see increased demand from families with children. And of course, even more Torontonians are facing food insecurity, but not even making it to the doors of our food banks, which we know is the case for many single parents who face time and resource barriers to accessing services like ours. Importantly, food insecurity is not just about momentary hunger. It has severe and long term implications on the mental and physical health of children and families. And that's why I'm here today to urge this board to continue calling on the provincial and federal governments to increase and immediately flow funding for the student nutrition program beyond the inflationary increases being considered today. Toronto, just about the program, Toronto has the largest scale of need for a student nutrition program in Ontario, and yet the lowest funding per student. And due to inadequate funding, we see inequities across the city, with some schools able to offer full meals thanks to supplementary funds from outside the program. Some schools unable to provide more than half an apple and a cheese string, and then some schools not providing any meals at all to students in greatest need. And that's really concerning because no child can learn and grow in a healthy way on an empty stomach. And we also know that students being left behind are disproportionately low income, racialized, newcomer, facing a disability, or intersectionally marginalized in some way. We hear stories from our food bank clients not only about child hunger, but also about parents doing everything they can to ensure that their children are fed throughout the school day, leaving the parents themselves to go hungry, face health challenges, and forego basic items and services, including things like internet and so on, which many of us take for granted. And this in turn has proven mental health consequences for their children. We also hear stories about single parents and refugee families being forced to survive on only $700 a month through Ontario Works because they are unable to find employment as they struggle to provide childcare and food for their children throughout the summers when schools are closed. As my colleague Susan mentioned earlier today, the city has extended its definition of student nutrition to include summers, and our clients need an expansion of corresponding summer food programs. We therefore urgently call on this committee and the city to work with the provincial and federal governments to increase and immediately flow their promised investments in Toronto's student nutrition program so that no child goes hungry and students across the city get the support they need to learn, grow, and thrive. And as various speakers have made clear today, a fully funded, universal, and year-round student nutrition program could go a long way in creating a more equitable city and improving not only food insecurity, but also mental and physical health amongst families with children who are struggling to secure their basic right to food. As you know, you have a partner in us at Daily Bread Food Bank, and we are ready to work with you to make this a reality. Thank you very much for your time.
Thank you very much, Zahara. Any questions for the deputant? Seeing none, thank you so much. Next up is Lindsay Jennings. Are you here? Online?
Hi there. Can you hear me?
We can. You have 5 minutes. Go ahead.
Okay, thank you very much. Good morning. My name is Lindsay Jennings, and I am a research associate at Carleton University with the Tracking and Justice Project, where we track deaths in custody. I'm also a community investigator at McMaster University Department of Family of Medicine, where I lead a prison health research council made up of people with lived experience. I am someone who survived substance use, survived homelessness, and survived incarceration. I used drugs in a time where there was no SES, very minimal harm reduction supports. There was very limited supports for women coming out of jail, let alone women who use drugs, which created a cycle of going back to environments that were not safe or stable for myself. I am speaking out today as individuals being released from jail is the responsibility of municipalities. Supervised consumption sites offer significant benefits for people being released from jail during a vulnerable time, helping them navigate the transition back into the community more safely. The operational budget and massive defunding of the OAT program and SES programs are going to cause more overdose deaths for those being released from jail. A recent study in the medical journal PLOS1 found that 16% of all toxicity deaths in Ontario occurred among people who had experience of incarceration. It also found that overall risk jumped substantially when COVID-19 emerged with a slew of public health restrictions that reduced services, but the increase in risk was particularly large for people who have been behind bars or released. Defunding SES and other harm reduction services removes the only service. I'm going to repeat that. It removes the only service that individuals being released from jail who use substances can access that provides immediate, non-judgmental care and connects individuals to broader support systems. SCS offers clean needles and other drug supplies, which helps prevent the spread of bloodborne diseases like HIV and Hep C, which are more common among people with a history of incarceration. SCS reduces the incident of public drug use and the associated issues of discarded needles and public intoxication, which are often concerns in community and lead people back into the cycle of incarceration. Also, SCS often provides access to other critical services, including addiction treatment, mental health, wound care, food services, and other social services. This is crucial for people leaving jail who may need assistance with housing, employment, or healthcare. In August of 2015, Brad Chapman died as he was discovered unconscious with drug paraphernalia around his body on Walnut Street in downtown Toronto. During the coroner's inquest, it was identified that Brad was released from jail just 2 weeks before his fatal overdose. It was heard that he was not properly helped by the police when he was found. When asked if her son would have benefited from the injection sites that have opened in Toronto since Brad's death, Corinne Chapman said, absolutely. She praised Toronto Moss Park harm reduction site, which opened against city regulations in 2017 as a highly successful operation, and said her son would have most certainly used one of these sites rather than using drugs on the street. Corinne Chapman said she'd like to see the province open more overdose prevention sites in response to her son's death. It would have been perfect for him, she said. I know we need more of those. The recommendations from the inquest outlines the need to expand services for individuals being released from jail. We also know from a recent report from the John Howard Ontario called Locked Up and Locked Out, the immediate action and investment in supportive and affordable housing options for justice-involved individuals supported by SCS, OPS, and harm reduction supports and services would help save lives, reduce harm, support public health and safety. It would also be cost-effective to invest in the expansion of these sites and increase funding for the other social services and current harm reduction programs offered within the sites. My call on today is that the Board of Health should reverse the defunding of the OAT programs, the supervised consumption sites, and all of their staff in order to save the lives of the people you are responsible for in this city and is continuously ignored by the Ontario government. Thank you.
Thank you very much. Any questions for the deputant? Seeing none, thank you for coming in today.
Thank you.
And Justin Ariza, are you here? Online, Justin Ariza. Okay. You have 5 minutes. Go ahead, Justin.
Thank you to the Board of Health for allowing me to speak today. My name is Justine Lisa. I'm a healthcare provider, community member, and constituent of the city and Ward 9. I'm here to speak on behalf of the closure of safe consumption sites across the city and change in harm reduction supports. I'm also here to paint a picture of what being in the front line of this work looks like. As a healthcare provider throughout the GTA, I understand and acknowledge how many lives these sites have saved and health risks have been reduced, the lives of many people I support. The closure of these sites is a death sentence. It will result in mass death and put an increased burden on healthcare services that are already crumbling. More people will have to use unsafe spaces to use substances, and there will be more public drug use, including needles. I work within a team that provides outreach and primary care support to unsheltered Torontonians. What the announcement and plan for Heart Hubs fails to acknowledge is that many of these supports already exist. This decision fails to acknowledge that we need a spectrum of care that includes harm reduction, treatment, and everything in between. We don't need one or the other. As a team social worker, I support folks with housing application, system navigation, accompaniment to appointments, and hospital visits. I ensure they stay connected to registered nurses and family physicians for medical treatment, interventions, and access to safe supply. I support folks in referring them to additional services that are imperative to their health and to access support for their substance use on all spectrums, from harm reduction supplies, safe consumption sites, detox, outpatient and inpatient supports, and to achieve whatever goal they desire in their recovery journey. We, as a team, we work collaboratively with the lowest barrier supports, including safe consumption sites, drop-ins, churches. They help us pave the path between life-saving care. Safe consumption sites and drop-ins call us often and say, hey, this person is here looking for you, and we go to meet them. They are not only vital to keeping the people that we support alive, but they're imperative in ensuring that they stay connected to the people that they trust to their main supports. The difference is that safe consumption sites are rooted in science, evidence-based practice, and they understand that people cannot reach recovery if they die before their name reaches the top of a wait list. In this announcement, the government fails to acknowledge that safe consumption sites are a place that many Torontonians call homes, because this is all they've got. This is a place that they often turn to when there is nowhere else to turn. Systems put in place by our provincial government repeatedly fail our most marginalized communities. My clients have been discharged from hospitals to streets, at times medically stable on paper, but left to keep post-operation wounds clean in tents, bus stops, alleyways. Our team is often called to emergency departments, general medicine wings, and ICUs to meet clients in hopes for them to continue their care once they return to the streets. It is almost impossible to heal without a home. I echo many of the words that the deputants before me have shared. After the announcement that 10 Ontario safe consumption sites, including the 5 Toronto sites, will be forced to close, many of the clients that receive care in these spaces and through our team feel as though the government wants them dead. Providing empathy in these times is simply just not enough. We are tired of grieving. This is a public health emergency. This will not go away, and we need you to name it for what it is. I insist on the Toronto's Board of Health to take swift action to ensure the ongoing operations of safe consumption sites, harm reduction services on a full spectrum. We welcome this funding, but at that, it shouldn't come at the cost of what we already know exists and works. This has been proven. Please, please, we call on you to ensure this permanence of these life-saving services. Thank you.
Thank you so much. Any questions for the deputant? Seeing none. Thank you for coming in today. Is Colin Johnson here? Or Owain Evans? No, neither of those two are here. Okay, so that ends our deputations for today on this item. Any questions from directors?
I do, Mr. Chair.
Okay, go ahead, Councilor Bravo.
Thank you. Thanks to everyone who's out to Depute. I wish I could be there in person, but I'm sick. To staff and through you, Chair, I'd like to ask if it's clear to all of us, would you agree that the full impact of both the funding and the program funds on the provincial changes that have been announced to supervise consumption and harm reduction services, it's still yet to be fully understood? And will we be receiving a report to this board really outlining the full impact in the coming future?
So through you, Mr. Chair, I'm sorry, Councillor, it was difficult to hear your question. I do believe you were asking about reporting back to the board in respect of the impact. I do want to be clear.
I'm asking if we fully understand at this time what the impact will be, and if there will be an opportunity in the future for this board to receive a report outlining that impact once it's really been made clear.
So through the chair, yes, of course, as we get more details and are able to articulate what the anticipated impact of the proposed policy change is, we will certainly bring that here to the board for your consideration and deliberation. I do want to be very clear, though, that the reflections here within the budget are just that. They are reporting back to the board in respect of budgetary changes as we understand them. That the federal government has funded us for certain programs, specifically the injectable opioid agonist treatment program, until the end of March, and we have no further word from them around ongoing dollars. By the same token, with the provincial policy change, we've heard that funding for the current supervised consumption service that we've been operating at the works since 2017 will end as of March 31st. So what you're seeing in this budget report is our current understanding of the financial situation for 2025 as we understand it now, premised on the word we have received from both the feds and the province. It in no way indicates what our stance is in respect of what's needed, according to the evidence, to address the drug toxicity epidemic that is faced in this city. I've been very clear about that from the beginning of my days here at Toronto Public Health. I will emphasize once again, for the benefit of the board, that it is a comprehensive continuum of services. Yes, exactly as people have said here, harm reduction and treatment are part and parcel of that continuum. And interestingly, what we haven't heard as much, but is crucial from a public health perspective, is prevention. Prevention, harm reduction, treatment both in the acute case and in the chronic ongoing sense, along with all the supports that actually make all these services more successful or more likely to be successful. Housing, income supports, connections to community and social supports. These are the kinds of things that are necessary in order to appropriately address the drug toxicity epidemic that we are witnessing here in this city and beyond.
Thank you.
My mic is off. Councillor Perks, go ahead, you have 5 minutes.
Thanks. And Mr. Chair, so you know, I've spoken with legal offline, so I don't need to go in camera. To the medical officer of health, a number of deputants made the point that treatment by itself will not create the kind of outcomes we want, and that harm reduction is a crucial pillar in any approach. Do you agree with that?
So through the chair, yes, as I've just said, I think an entire continuum of service, prevention, harm reduction, and treatment. And those are much deeper issues, each one of those. It is much, right? Treatment takes multiple forms, as does harm reduction, as does prevention. All of them are needed.
Thank you. Additionally, a number of people made a very specific point, which is unless you have a safe consumption service of some kind, there will be more deaths. Do you agree with that?
So through the chair, I think even as we have seen, even with supervised consumption services, we are continuing to see deaths related to the drug toxicity epidemic. There's no question we have had an impact. We have seen a reduction with supervised consumption services, but I think we should be clear that we need the full spectrum of interventions, from prevention to harm reduction and treatment.
I just need a very specific thing. So yes, supervised consumption. Okay, thank you. Additionally, some of the people making deputations made the point that by closing supervised consumption services, we will have a negative impact on the capacity of Toronto Paramedic and our emergency rooms and other aspects of the healthcare system. Do you agree with that?
So through the chair, I suspect that that will be true. The extent to which we will see that, I don't know that any of us can really say, but yes, I anticipate there will be impacts on healthcare, emergency services, and paramedic services as well. To say nothing of the other social services that support those who are experiencing substance use challenges, particularly those who are experiencing homelessness as well.
Okay, and just two questions to legal, which I think we can ask in public. First, there has been a Supreme Court decision in the past that says that access to medical services like safe consumption services are a right, and that the federal and provincial governments cannot take that right away from people. Is that correct?
Through the chair, I'm generally familiar with that case, yes.
Okay. And additionally, whether the province orders these sites closed or not, it's within the purview of this board to allocate money which could be spent which could potentially be spent on these services. We can allocate that money, correct?
Yes, the funding decisions are separate from any legal prohibition, which we haven't seen yet. So I think that's correct.
Thank you, Mr. Chair. Those are my questions.
Okay, thank you. Any further questions from anybody?
Sure, I have a question.
Go ahead, Councillor Sriskandarajah, 5 minutes.
Trustee, but don't wish that on me. Through you, Mr. Chair, I just have a question. I just want to thank the delegates who came forth to speak about the food nutrition program. We, of course, at the school board constantly grapple with this and just sort of how uneven our programs are. So there are a few delegates who spoke to the fact that the commitments we've made have not been necessarily the targets we'd set for ourselves. So is it safe to say that this will only cover the inflationary cost, that we will not actually be able or have the capacity to open any new sites?
So through the chair, Trustee Sriskandarajah, I'm not sure I understand entirely the question. Sorry, could you reiterate? I don't mean to make it more complicated.
Yeah, no, just the last part I'll repeat. The cost that we're dedicating to the food nutrition programs, that's only to cover the inflationary costs, the increases. So we're not going to be able to have the capacity to open any new programs or support any new programming.
So through the chair, no. In fact, what we have put forward for the board's consideration is both something to account for the increased cost of food and some dollars towards increasing the capacity, the number of students that are actually covered by the program.
Perfect, thank you. That's how I read it, but I did hear some of the delegates. I just wanted to clarify for them. Do we have any insights to how many programs or how many students will be able to feed with the new proposed numbers?
So through the chair, as I understand it, and I'm looking to my colleagues, I believe we have counted both for an increased cost of food and an expansion of the program to another 5,200 students.
That's correct. That's correct.
Okay, thank you. That's my only question. We'll have an opportunity, Chair, to speak on this after, right? This is just the question period?
That's correct. You will speak up to 5 minutes on this item. Thank you. Councillor Thompson, I think I saw your hands up. Go ahead.
You did. Thank you very much, Mrs. Chair. Through you to Dr. Davila. Dr. Davila, Vancouver has recently not renewed their lease with respect to their harm reduction facility. Is that correct?
Through the chair, I am actually not sure. I'm happy to look at
so
any of my colleagues
have.
if they're familiar.
Yeah, they have, and I'm just curious, and I was going to ask you, sort of what the impact has been. So maybe I'll just save that for another day, because many years ago I visited that facility as to your predecessor from a long time ago had asked to visit, and I think Councillor Perks and we and others worked really hard to help the city in terms of establishing its drug prevention policy and so on, because there really wasn't one back in the day. And I know that my visit there was very helpful in helping me to be more informed, actually, that it does actually work. So I guess my question to you then, given the provincial decision and I'm not really clear. Is it simply, I mean, part of it is funding, but is there an issue with respect to location as to where the facilities can be located as part of the recent decision made by the province that has an impact with respect to where these facilities can actually locate?
So through the chair, I am a little loath to speak on behalf of the province, but as I understand, right, as I understand the information, they have indicated that they have launched a move to establish this demonstration project for these heart hubs. And with that, they have indicated their intent to cease funding and the operations of certain supervised consumption services, including 5 here in the City of Toronto, one of which is the service that we as Toronto Public Health have been operating since 2017. My further understanding is that the reason why those places were chosen, at least in part, and again, I'm not speaking for the provincial government, I'm giving you information as I understand, and that which has been communicated to us, is that they are interested in seeing a separation, a distance of 200 meters between schools and or childcare facilities and the presence of supervised consumption services. And it's my understanding that the locations that have been designated for closure and defunding are in violation of that new policy direction that the province has set. We further understand that there is impending legislation that they are going to introduce. This was again made as a provincial announcement last month, the details of which have yet to be released or really therefore analyzed and understood by our team or frankly by anybody else who is currently an operator of supervised consumption service. But as mentioned in an earlier answer to one of the questions, certainly as we get more information and have something to report to the board, we're happy to bring that back. I think that's the situation as I understand it.
Thank you very much for that, Dr. Davila, and certainly by no means were I asking you to speak on behalf of the province. It was simply the clarification, and obviously you've expressed, with respect to your answer, given me more detail. So that's very helpful. Thank you very much for that. Notwithstanding that fact, though, given the limitations and the distance policy that the province has actually highlighted, in order for us to move forward and to help those who are in need of help, the City of Toronto, if we are not being funded by the province, may then have to come up with a budget to respond to the needs that exist in our city. Would that be safe to sort of make that comment or that injecture in terms of a position that we would have to adopt? Obviously, it will be a cost, but at the end of the day, overall, there could be great benefits in terms of saving in healthcare and so on.
So through the chair, certainly when we come as your staff to this board with recommendations around what can be done within the purview of public health to improve health and to protect health within the city, we are coming to you with budget requests and or with recommendations. Of course, when it comes to issues that are more related to health care, this is where it gets a little more delicate. Healthcare has traditionally been funded and is the purview of the province. So it becomes an interesting balance that the board and or council needs to strike in respect of how much healthcare you wish to engage in and you wish to fund versus that which should fall under the provincial purview.
Thank you. Thank you, Mr. Chair.
Thank you, Councillor Thompson. Any other questions of staff? Director Roy, go ahead, 5 minutes.
Thank you, Chair. Through you, Chair, to the Medical Officer of Health. We just heard that with the new proposed budget, you are adding 5,200 students in the student nutrition program. Now, is that inclusive or exclusive of potential federal funding that might come towards that line?
Sorry, through the chair, that does not give consideration to federal funding. This is just municipal funding that we're proposing to both meet the increase, I should say, in the cost of food and to allow for a further expansion of the program.
Excellent. And potentially, hopefully, there will be funding coming by 2025 beginning. And if it does, do we have the capacity to quickly pivot and expand that program right away?
Through the chair, as you know, we've been strong advocates for a national school food program. We are looking forward to hearing about what our federal partners have in mind for us in terms of how much money we might expect to receive given their announcement earlier this year. We have not received any word yet, but certainly we are prepared to work with other partners should we hear something in respect of how much we might get from the federal funding announcement.
Thank you very much, Mr. Chair.
Thank you. Any further questions? Seeing none, okay, so we'll go to speakers now. Go ahead, Councillor Perks.
Thank you, Mr. Chair. Members, I want to address specifically the lines in the draft budget having to do with safe consumption services and exchange services. I understand the chair has a motion that he's circulating that removes the cuts, right? The budget proposed cutting those two lines because we've heard from the federal and provincial governments they won't be subsidizing it. The chair's motion removes those cuts, so keeps them in the budget. This does a couple of things. First of all, it stays with council and this board's policy that supervised consumption services are a necessary health service. That's also something that the Supreme Court of Canada has recognized. So we keep the money in, and that puts the city in a position to keep trying to make the argument that the federal and provincial governments need to come back to the funding table for these services. And that's something that I hope that all of us on this board will be advocating for in the coming weeks and months. Because as you heard from both the academic experts, the people who run services, people who use drugs, and people who are direct service deliverers, you cannot substitute prevention for harm reduction. Harm reduction is a necessary tool in saving lives. That's very clear. You also heard, if that's not an adequate argument, a very powerful argument about the knock-on effects throughout the rest of the healthcare system. We would literally be making healthcare services worse for everyone in Toronto if we just folded up our tent and let the province have their way here. This is a moral imperative. Many of you will know the term social murder. That's when the actions of a society or a government contribute directly to the deaths of some of the people in that society. The province's decision here is a clear-cut case of social murder. Many of the people that we are here to represent on this board, whose health interests we are supposed to advocate for, will lose their lives if the province continues down this path. I know many other members of council are outraged by this, and we will be fighting the province on this issue. And I think that today we can begin that fight by sending a signal that we will keep the funding for these services in our budget, and that we need to advocate collectively as Torontonians to save lives and to stop using stigmatizing politics as a way of gaining power at the expense of lives of people we represent. Thank you.
Okay, thank you, Councillor Perks. Others to speak? Councillor Bravo, go ahead.
I can go after yourself, Chair, if you want to introduce your motion.
I know you can go ahead. I can do it after.
Okay. I first want to thank all of the deputants that came in today. The eloquence and clarity around both safe injection harm reduction services and student nutrition programs is really important for this Board of Health to hear. And I think you will find a lot of support and alignment, as Councillor Perks has indicated. I will be supporting the chair and his motions to ensure that while the decisions that have been made at the provincial level are very specific, and the province does have the power and authority to overrule the work of the City of Toronto, we need to not foreclose the fight that's going to happen in civil society and with allies in public health to make sure that this decision is reversed. We can't give up this fight. It's too much work has been done. Members of this committee have been here longer, and we're part of bringing these services to Toronto. But I also want to just point something out. Public health is a social movement. We have water testing because people were fighting the deaths that were happening in Toronto before water testing. And these population level interventions often start here. This idea, the subversive bringing of these services into Toronto by civil society and social movement actors is the reason that we have these services in Canada, because people fought for, organized, and risked a lot to make sure that we're taking care of each other. We cannot have a good society in which we deem certain people expendable. And if we're going to have a society worth a name, then we meet people where they are, where their needs are, and provide the services that are appropriate. And this is a healthcare service, as the medical officer of health has indicated. But I think by adopting these motions from our chair, we will indicate that in the fight to save lives, to create pathways for a good life for people who are using drugs, wherever they're coming from, we are partners in that fight. We are supporting, we are creating the conditions, enabling our social movement partners to not give up and to continue. It's the same with student nutrition. The idea of feeding children largely started in this board. I have to say that, 20 years ago, I was working in the schools as a parent leader, and we extended at the time student nutrition to secondary school students because of the importance of making sure that they had a meal to be able to stay in school. These things are tied to me. They're about ensuring that people have the tools and the resources that they need to thrive and survive, not just survive, but thrive. So I appreciate the intelligent and fact-based information that's been shared here. I want deputants to know that we agree and that we are as concerned and horrified about the decisions that are being made on the backs of people who are vulnerable, to politicize and to polarize in this country. And this Board of Health, I hope, will take the side of what is right, what is proven, and what actually shows the care that is needed to protect public health in this city and in this country. Thanks, Mr. Chair.
Thank you, Councillor Bravo. Trustee Sriskandarajah, go ahead, you have 5 minutes.
Thank you. I just wanted to share a few thoughts on the student nutrition program. There's not really much more I can add from the delegates who made such powerful and impactful statements. Something we continue to grapple with. I know we're waiting for federal funding, but until we see the impacts in schools, I think we're very cautious about that. I'm happy that we've made commitments, or the board has made commitments, but we still have so much more work to do. I know my fellow trustees have reached out and said that they really wanted me to share some of the issues we deal with at the board, because it just the day-to-day functioning of these programs might not be something that everybody here understands, just because the decisions are often so far removed from those who are actually living these programs. Many deputants mentioned the increase in poverty. the fact that these programs rely so heavily on donations, that becomes even harder to run when in a climate of fiscal insecurity amongst the general population. So those who give are just not able to give. Also, these programs are volunteer run. So, people are stretched for time, capacity. It makes these programs really dependent on oftentimes neighborhoods that are able to coalesce, networks that not everybody necessarily has. And so when we think about food programs, it's not just the actual foods themselves, but how are we delivering it? How are we ensuring there's consistency in that? And what we're seeing is that despite increases in dollars, there's continuing to be decreases in what they can actually provide. And I think, the deputants, as one mentioned, there's programs that they're only able to give an apple and a cheese string. And, that's not necessarily, that's in conflict with the food guides that we recommend. So I think there's a lot of mismatch here happening. But, thank you to the Board of Health. Thank you to all the deputants. I just want to make sure that we always keep this in top of mind, since we're so close to the promise of a potential national food program in a way that we haven't been in a long time, but also very cautious until that actually rolls out and happens. So thank you. Thank you for these important conversations today.
Thank you, Trustee Srishkala. Any other speakers on this item? Director Roy, go ahead, 5 minutes.
Mr. Chair, thank you very much. First of all, thanks all the deputants for an amazing presentation. I'm going to circle back on what Trustee Srikandaraja was talking about, is the student nutrition program. First of all, Chair, thank you so much for the motions that you are going to put forward. We saw the draft of it. The federal program on a national school food program. We do not want that to be another $10 daycare fiasco. We do not that $10 daycare is not important, but now we heard from Daily Bread, we heard from North York Harvest about the magnitude of the problem in our communities. And we see it on a daily basis. We need action now, and I'm glad that we are going to try to have those conversations to make sure by 2025, in the beginning of 2025, we can try to get some funding to increase those numbers. However, I also want to caution that this is not something to rejoice and sit back, because all we are getting nationally is $200,000 a year, which is not even a drop in a bucket. And that conversation needs to be pushed and continued. And we have, on the Board of Health, for years and years, had this conversation about asking the feds to come forward for the student nutrition program. And we have got something, and I'm thankful, but this is not where it stops. As a Board of Health, we need to continue this conversation. We need to start asking for more and actually making food a human right for our students and for our communities. Thank you.
Thank you. Any other speakers on this item? Okay, seeing none. Okay, I'll then proceed to speak to my motions. The first one staff can put up, it's around what Councillor Perks spoke about in regards to adding the funds for the safe consumption sites to the city budget. I want to give credit to Councillor Perks. He's worked with staff and myself on this item. He's proposing that the Board of Health request the mayor to propose in the 2025 operating budget the entire cost for safe consumption sites at a cost of $285,898 for 2025. Again, public health was notified by the province that they would stop funding for this. So legally, they've had to bring this forth. So again, we're asking that the city take this on and proceed, period. Until further notice, until the province says to us that we cannot proceed with this but I think we have to proactively do this. Majority of safe consumption sites that are closing will be in my ward, in Toronto Centre. People in my community will be mostly affected by this. I spent the last couple of weeks going to different safe consumption sites across the city, also in my ward, and talking to the staff and to the clients themselves, and talking about the fear and the harm that they feel if safe consumption sites are closed. So again, I think it's been well articulated by the deputants and many of my colleagues here on this, and the vital importance of the services in regards to harm reduction and the safe consumption sites. So I hope that my colleagues will support me on this motion. The second motion that I'm asking staff to put up is around requesting the Government of Ontario to continue funding safe consumption sites and harm reduction services, and also to allow the hard hubs to allow them to have safe consumption sites as well within their doors. Because as it stands now, as we've been advised, that is not the case, and we know that it's a continuum of care when it comes to harm reduction, and follow the science, right? Not the politics. And so I'm standing with the science and with our caregivers and the experts in the field to make sure that this very vital, important service continues. And it does save lives, as we've heard. My third motion is around student nutrition. I'm losing my track of my notes. So we're asking that the medical officer of health coordinate with the city manager to engage the Government of Canada on the 2024 federal budget commitment. So for 2024, we're asking for this $79 million be front-loaded so that we can actually provide food, nutrition to our kids in our schools in Toronto. And for the 2025 budget, that $220 million be forwarded to the City of Toronto for student nutrition services. Again, as many of the deputants mentioned, and also Trustee Shrishkan-Raja mentioned, this is vitally needed here, and we really should make it a priority. And reaching out to the Government of Canada is one of the first steps to do that. So again, those are the motions. If you have any questions, I'm happy to answer any questions you may have.
Sorry, we also need a motion to extend.
And we also need the motion to extend. Before we vote on that, I will put a motion forward to extend to the end of the meeting, the end of the agenda. All those in favor? Opposed? Carried. Thank you. If there are no questions to my motions, we could put them back up on the screen and we'll vote on them one by one. Okay.
Could we record this, please?
Sure. Clerks will proceed with the recording of votes.
Thank you, members. This is a recorded vote on item HL 16.2, motion A, moved by Councillor Moyes. When I call your name, please indicate your vote. Director Bravo?
In favor.
Director Chandrabalan? Is not present, I'm sorry. Director Malik? Director Moyes?
In favor.
Director Morley?
In favor.
Thank you. Director Ozude?
In favor.
Director Perks?
In favor.
Director Roy?
In favor.
Thank you. Director Shrishkan-Raja?
In favor.
Thank you. And Director Thompson, if he's online still?
In favor.
Thank you. Sorry, I couldn't see all the thumbnails. Thank you. And Director Zhao? Present. Thank you. The vote, the motion carries unanimously.
Okay. Do you also want the second one recorded as well, Councilor Perks? No? Okay. The second motion. Okay. All those in favor? Opposed? Carried. Thank you. And the third motion? All those in, okay. Okay, all those in favor of this item? Opposed? Carried. Thank you. Item as amended, all those in favor? Opposed? Carried. Thank you. All right. Which one's item number 3? Okay. Yeah. We also need to vote on HR 16.3. All those in favor of the item? Opposed? Carried. All righty, good. So we're now at... Should do that now then. There's a lot going on here today. I also need to introduce a new business item. If you put it on the screen, it's, yep. Critical needs for universal student nutrition. This recommendation is requesting the Medical Officer of Health to report directly to the October 9th, 2024 meeting at Council with a phased-in plan to implement a universal school food program in January 2025 if the federal funding flows by November 2024, including prioritizing of the more than 40 school communities that recently applied for a program and were denied due to lack of funding. Okay, let's vote on this item to add it to the agenda. We're good? Okay, all those in favor? Opposed? Carried. That's added. Thank you. The next item. Okay, item 16.6, Councilor Bradley held that item. Dental mobile care program. There are no deputants on this item, so you can go ahead and ask questions if you like.
Thank you, Mr. Chair. I just have, I don't need to ask questions, but I do have a motion.
Okay.
Unless others have questions, that the Board of Health requests the Provincial Ministry of Health to allow the proceeds of the auction of Toronto Public Health's dental bus, estimated at between $40,000 to $50,000, to be retained by Toronto Public Health and applied towards the purchase of a new mobile dental van. I feel that it's important to ask this of the Ministry of Health because our dental program is something that's so crucial, and I think that Toronto Public Health and Board of Health for its advocacy over the years around universal access to dental care, especially for those most vulnerable, is something that we should legitimately be proud of and continue to uphold. It's an easy win for the provincial government here to continue to support our local public health dental programs without new spending. So this is a smart money motion. It's a request. Currently, we auction the existing bus, which is at end of life. We're required to return the funds to the province when we do the auction. I think it's important to give the provincial government the opportunity to allow us to keep the proceeds of the auction so that we can purchase a new dental van, which is also approved in this item. If the provincial government agrees, this would generate a savings to Toronto Public Health of $40,000 to $50,000, and in these financial constraint, I hope that they agree.
Thank you, Councilor Bravo. Any questions of the mover? Seeing none, okay. All those in favor of the motion? Opposed, carried, as amended? Okay, as amended, all those in favor? Opposed, carried, thank you. And the next item is appointment of members of the Our Health, Our City Implementation Panel consideration. Deputy Mayor Malik wanted to speak to this item? Or you have any questions of this item?
I don't have any questions, but.
Okay, anyone else have questions of this item? Seeing none, okay, speak to it, go ahead.
Thank you very much. I'm very honored to be speaking to this item today. When we launched Our Health, Our City last fall, we launched our city's new strategy for mental health and substance use, and we reaffirmed our commitment as a board to the mental health and well-being of every Torontonian and to addressing the health and the social impacts of substance use. And as we know, there is absolutely no one who is untouched or unaffected by the impacts of mental health and substance use in our city, and as we're seeing across the province and the country as well. We see and feel this in our circles and in our communities every single day. And we are facing serious challenges that exacerbate the ways that we are able to address this crisis. Drug toxicity, high living costs, housing accessibility, and the lingering impacts of the COVID-19 pandemic, which is why our work together is even more critical, more important, and more timely. And as a city, we must care for each other, creating community and building a city where our sense of belonging strengthens us and allows us to be more capable in addressing this crisis with the seriousness that it requires. And we know the importance of policy-based, evidence-based mental health and harm reduction supports and how they can build a safer, more inclusive Toronto and also set an example right across the province and country. And we know that this implementation panel is also coming at an incredibly challenging time. We heard that here at the meeting today, a critical time where lives are at stake, even more heightened across Toronto and across the province. And decisions being made by other levels of government have serious ramifications for the health and well-being of our neighbors, our communities, and our city. And I'd like to thank everyone who applied, put themselves forward to be on this panel, for stepping up and providing leadership to our city to improve supports and services, save lives. And it is some of the most challenging and most important work that there is, and it is undeniably important in this moment. And we'll all continue to have an important role to play. Everyone who did raise their hand, put themselves forward, will continue to be part of this work together with us and the work that we are doing collectively as a board to see this strategy implemented. I want to just share a few specific thank yous to the fellow members of the review panel that brought forward this set of participants to the implementation panel as we move forward. Of course, Dr. Eileen Davila and Dr. Stephanie Zhu, and to Upala and Kirthana and Vanessa from Toronto Public Health for all of your incredible support and coordination, and for the thorough work in following up and reaching out to everyone who expressed their interest in being a part of this process, especially as we embark on the implementation of this really critical strategy in this moment. Thank you very much.
Thank you, Deputy Mayor. Okay, we can vote. All those in favor of adopting the recommendations? Opposed? Carried. Thank you. Next item is item 16.8. I spoke to this briefly already. It is the, a second. All right, thank you. So this is the mpox item. As I mentioned, that there are limited organizations that actually can administer the mpox vaccine. And so we're asking Health Canada to allow others to be able to do that. For example, even pharmacies, for example. So yeah, so all those in favor of this item? Opposed? Carried. Thank you. The next item is around the critical needs for universal student nutrition, which I just spoke about just recently, and the Medical Officer of Health working with to presenting at council at the October 9th meeting, talking about the funding for the Universal School Food Program. So all those in favor of the item? Opposed? And that's carried. Thank you. That's it. So the meeting is adjourned. It felt a little messy back and forth, but I think we got through it. So thank you, staff. Thank you, my colleagues. Thank you, everyone. And see you at the next meeting. Have a great afternoon.
Bye.